Okay, hi everybody. So today we're talking to speech language pathologists or speech therapists in the UK, and I have four people here: Swathi, Athira, Asha, and Meghana. Let's start off with an introduction. So Meghana, can you introduce yourself and tell us where you did your bachelor's and master's and what you're doing currently?
Yeah, absolutely. I come from Chennai in India, and I did both my bachelor's as well as master's in Ramchandra University. So that was about like 6 years of just education, followed by about 2 years of working in an acute inpatient, come say outpatient kind of a setting called Hamsa Rehab. And then I just recently moved to the UK about like say 7 months ago. So I
Okay.
live in Doncaster. That's near Sheffield in South Yorkshire at the minute.
Okay,
So
okay.
got me.
All right. So what setup do you work in right now?
So I work as a speech and language therapist with the neuro rehab outreach team. So I work in a community as well as an inpatient setting. So it's a bit of a mix between inpatient, outpatient kind of
Okay,
stuff.
okay. All right. Okay, so thank you so much for joining us. Maybe we could have Asha Thomas next. Could tell us a little bit more about herself.
Hello, I'm Asha. I did both Masters and Bachelor's BA from Dr. S.R. Chandrasekhar Institute, Bangalore. I worked for 2 years after that in Bangalore. Like, I was with Swathi, so that's where I met Swathi, and
Oh.
we both worked together in Magpie in JP Nagar. Then for a year and a half, I did there, and 6 months I did in Little Blue Jays in HRBR layout. I moved to the UK in July 23. And yeah, it's been a year, more than a year now. And initially, I was working in camps, which is a different setup for autism team over here. I have worked in different settings, to be frank. So first 3 months, I did camps. Uh, then I did adult mental health. So it's inpatients for adults with dealing with mental health issues. So I've done adult mental health. I did not like both the jobs. So then I applied for a new job, community based. So now I came, moved to Newcastle, near that side was Darlington, North UK. Now I'm currently in Stevenage, which is like towards South London and yeah, near to London. So I'm a community-based speech and language therapist now. So most of my work is in schools. So I go to schools and do uh, community work mostly. Yeah, that's
Okay, that's nice. So Asha is my senior in college back in Bangalore. All right. Swathi, can we have your introduction?
I think it's a really nice way because Asha's already said half of the things I'd probably have to say. I'm Swathi. I've been a speech and language therapist for about 8 odd years now. You can tell my age. Anyway, I did my bachelor's and master's both in Aish, the All India Institute of Speech and Hearing, Mysore, and I did my first year of work there. I worked in the Department of Diploma Health, Language and Sciences, which is the DHLS program. It was a bit of mixture of both clinical supervision for the students across 2016 to 18 and academic curriculum-based activities and training for them as well. And then I came to Bangalore, Magpie Clinic. This was mostly because I was always inclined to working with kids and it seemed to be the most perfect fit. I've met Asha there. I've had brilliant colleagues. Everything that I've learned is because of Aish and Magpie. Honestly, I have to give credit to that. I worked there for about 6 years before I moved to UK, and it's been a little over 2 years here. I work as a specialist speech and language therapist for a hospital called Alder Hayes Speech and Language Therapy in Liverpool, which is right next to Manchester because that's probably the more famous place to know where to locate it. It's in the northwest of the UK. And I work in the community team just like Asha. I have been working in the community team since I started. I do um, I do a lot of things and it's got quite a mixture to it. So I'll try and be as succinct as possible. I used to do 1 day of clinics, which is basically our speechy kids sessions, but I don't really enjoy the way we work with speech here, because it's really different to how we do it back home in India. And so I've traded that to something that I really am passionate about, which is specialist provision. So I do 2 specialist schools that I go to twice a month. I do mainstream nurseries and schools, about 20 that I go to. I do parent workshops and trainings and reviews follow-ups. I do initial assessments, which is where we do the diagnosis bits of it, and supporting students on placement, volunteers, speech therapist, language assessments. We are all part of that Northwest NHS network that I was talking about,
Okay.
which I co-chair as well. So that's been my journey so far.
Oh, okay. So a lot of things to discuss even later on.
Yeah. And thank you so much for having us here. I really appreciate what you're doing. I think it's really helpful. I wish we had something like this when we were reaching out to do it. When I started, I think I knew 2 people who were speech language therapists in the UK, and I think now we've got at least 22 just in a network that we're part of, which is really commending.
Oh, I'm really glad to have everybody. And the best part is everybody is okay to talk about it. Everybody's ready to share their information and they want the younger generation to have an easier way, you know. So it's
Yeah.
really, I'm glad I could do this.
Oh,
I mean,
thank
just
you.
to add to that, Manasa, I think I definitely second Swathi on that because just as she said, I think each one of us had a different set of struggles to get to this place. I mean, I didn't know there was even a network when I started working towards this. So now after coming and finding the network and knowing that at least there are 10 other people who are like us, it's such a relief. And there are so many of them who are kind of, I'm sure everybody else would have also got some messages, or their juniors or anybody else who's at any point trying to get to the UK and there's absolutely no information or they don't know how to proceed with the information.
Yeah.
So it's kind of really helpful what you're doing.
I'm glad. I'm glad I could help a little more people. All right. So Athira, can you tell us about yourself?
Yeah. Hi, I'm Athira and I'm from Kerala. So I did my bachelor's from Marthoma Institute of Speech and Hearing, which is in Kasaragod, again in Kerala. So after that, it was almost Corona time. So all my half of my internship went with the Corona, like all the all those lockdowns and everything. So following that, I worked as an audiologist and a speech therapist in a private clinic as well as in a hospital setup. So I worked almost for a year. Like, to be honest, I didn't have any plans of moving to the UK or working initially, but it was just fate and it all came together. So I started applying, like I always wanted to do masters. Then I thought, okay, I'll move to UK and try to do a master's over there. So I started applying into different universities, and it was really hard because again there was this COVID lockdown in UK as well. So a few universities backed out from giving visa to the students if you're an international applicant. So it took almost over a year for me to find a proper university and the course. And I did my master's from University of Reading in MSc Language Sciences. It was like a 1-year course.
Okay.
And following that, I got all my registrations to work in the UK and I started applying for jobs. Currently, I'm working as a specialist speech and language therapist in a mental health inpatient unit. So it's quite different from I know in India, we as speech therapists, we don't work in mental health units as much, but it was quite interesting and fascinating. So I just wanted to know what it is about. So I've been in this current role for over 2 years now.
Okay.
It's going good. Yeah.
Okay. But that is interesting. I think somebody else also mentioned that they work with this, no?
Yeah.
So yeah, it's pretty cool. I have not seen that in India at all. So okay, that's really nice. Okay, so we've had an introduction. I think we'll just dive right into the questions. So we'll talk about the work-related questions first. The most common questions that people ask me, and I'm sure they've been asking you also, your juniors or everybody else. What's the minimum qualifications you need to work as an SLP in the UK? So maybe Meghana, can you answer this question?
Well, I mean, I think it is all right to start off even if you have your bachelor's, because here, when I do see my peers or anybody else who's working, definitely they do come from different backgrounds as well. So I think it is okay if you have your bachelor's and a bit of experience so that you can kind of find your feet as soon as you get here. But having masters would definitely add more value to your application and your entire process as a whole. That's what I think. But if anybody has anything else that you want to add.
Anybody else wants to add? Swathi?
Sorry. Yeah, I've just muted because I live just by the bus stop. It's not the most pleasant sounds. I think Meghna rightly said it doesn't really matter as to if you've got a bachelor's or a master's, but I definitely do think having a master's makes it easier to get the HCPC.
Mm-hmm.
It also kind of depends on what kind of role you're looking to get into. So, let's say you don't have to think about a visa. There's someone already here and they want to just see how speech therapists work. They can join as a speech language therapist assistant,
Mm-hmm.
and that basically does not require any set qualifications, not even bachelor's, because people come from different backgrounds, different careers, and try and see how they can help and support the speech and language therapists here. However, the income there would be quite less. But if you do need a job that you need a sponsorship for, it either has to be a bachelor's or a master's. But like I said, and Meghna also said, I think it's easier if you've got a master's in terms of your HCPC, which is the license. But it can also, when you look at the job profiles, they will say if it's an essential or a desirable one. So you can always gauge how or what they're looking for based on those job descriptions as well.
Okay.
Don't know if anybody else had anything to add from their experiences.
Okay, all right. Then I'll just move on. So, like you said, it's either bachelor's or master's, which preferably master's, I guess.
Yes.
That's the thing. All right. If what's the first step somebody should do if they want to work in the UK as an SLP? Maybe Asha could answer.
I think getting a HCPC registration is the first step, which we all did. And yeah, that's the first step to do. And like the previous question, I don't think it is necessary you need to do a qualification here to get a job, or like if people want to, it's easier to come here and start doing or looking for jobs. To move abroad, it's easier to look up for studies, but I don't think like or like I have not I don't think like that's a add-on point to your uh getting a job, or a that's a plus point for you to get a job over here. That doesn't matter. And to be frank, after the registration, I think the job, I mean, my work or my theoretical background and all stuff had helped me. So I think HCPC is the first step towards, yeah,
Okay.
yeah. Then
Yeah.
start looking for jobs. Because when you apply for jobs also, I think people would ask you
First
for
for the
whether you have a
registration.
HCPC registration or not. So yeah.
All right.
Just
Yeah.
to give an alternate perspective, I did it the other way around because
Okay.
I was really happy with my job back in India. So this was just more, let's see what's out there, anyway, reasons aside. So I didn't want to spend a lot of money because HCPC is quite a lot of money. So for me, it was more, if I get a job, if people are willing to hire me, I will do HCPC.
HCPC. Okay.
Otherwise, I'm not bothered. However, like Asha said, if you've got HCPC, there's a lot more opportunities because all jobs will say
You
HCPC
need
is
to have.
basically the
Okay.
right to work. However, if they do like you or you get an interview and you're selected, they will give you a conditional offer letter to say within this time frame, if you can manage to get your HCPC,
Okay.
we're happy to give you the job. And that's how I came in. But again, like I said, it comes down to priorities and perspectives. There's a lot more options because you can go for all jobs if you have the HCPC. But yeah, I went the unconventional route, I guess.
I
Meghana?
just wanted to
Yeah.
add, like, it's absolutely right what Asha and Swathi said. Like, HCPC is like considered as a initial starting point. But however, to get to HCPC as well, there are a couple more steps which I think I kind of kept as on my pointers on my checklist. And the first thing was probably IELTS, because as a minimum requirement, especially because we are a speech and language therapists, our English language requirement for this country is a bit increased when compared to other allied health professionals.
Okay.
So what is expected out of us is an overall band of 8 with nothing less than 7.5 under each element. So well, we all know how IELTS works as well. And for people who don't know, the highest banding score that you can get in IELTS is 9, and 8 is like literally
pretty high. Yeah.
Exactly. So this is something that I kind of kept as a starting point, because it is it is doable. It's not to scare people and say that you can't get 8 in the first go, but some people need additional time. There might be good days and bad days, and that might just trick you in the end. So I'd say take your time with IELTS, prepare for it, give it first, see what's the score you're getting, because you might as well benefit spending a little lesser on the IELTS and making sure you get the score, then going ahead with the HCPC, which is like almost triple the cost of IELTS. So once you get to English language requirements, then you can put together all of the documents, because everything else is to be provided by the university and so on. I'm sure you were going to get to these questions later, Manasa. I'm so sorry.
No, that's okay. That's okay.
Yeah, just because I think some people need a bit more time with the English language bits as well.
It could also be TOEFL, and I think
Yes.
is it 100 on 120 that you need. The HCPC website has it listed, but it can either be IELTS or TOEFL.
Yeah.
And I think the brilliant bit about UK is you can either take the general or the academic version of the IELTS, which I think really again works out to people's strengths.
The
It
TOEFL
doesn't matter.
is
18, I think.
TOEFL was 118 out of 120.
Right, yeah.
Pretty high.
So I think what I came across when looking at different English language tests and their requirements, when I was looking, I just understood that everything is pretty strict. So if all the other professions needed like 2 bands lesser or about 20 points lesser, for speech and language therapists, it was 2 points lesser or like 1 band lesser. So that's how it was, which is understandable because it's a English
language based.
It's language based,
and it still doesn't help you with all the accents. I'm sure everybody will tell you about it.
Agreed.
Yeah. It just feels like you've walked into a place where it's not English, but it is, and it's just like our country. There's so many accents, but yes, I would say that's absolutely right, like how Meghana suggested. I did that too before my HCPC. Yeah.
Okay, so now let's get down to HCPC, because you guys have been mentioning it and I don't know how that works. Can anybody tell me what is the registration? How do you go about it? Meghana or Aasha?
I don't know. Aasha, do you want to go for it?
So I did it in a different way. Like I said, I did not do HCPC first. When I got recruited for the job, I probably you'll ask me about the recruiting part later, but so I did HCPC afterwards. So there's it's a registration like RCAI or ISHA, the license to work. So you need to have an HCPC registration to work in UK. So it's called Health Professional Council.
Healthcare Professional
Council.
Okay. So yeah. So it has got you need to submit a course information form, which is basically your syllabus, what you did in your master's and bachelor's, and you need to. That's one thing which I think we did. There's no CPC or anything. I don't remember doing it. I did it quite long back. So as far as what I remember, then you need to attest it from college and you need to get it from sign college and all those things. There's basic stuff like your personal information, your address, and these are things. I think from college only course information form was written. Yes, that's all I remember.
Anybody else wants to add? Yeah,
I did it long back. Sorry.
No worries.
That was really helpful, Asha. So I think so like Asha said, Health and Care Professions Council kind of it's more equivalent to our RCI in India. And in terms of ISHA is something that's more optional. Not everybody is
correct.
Yeah. So similarly, in the UK, we have something called as RCSLP, which is Royal College of Speech and Language Therapists.
Sorry, can I just interject, Meghana? Sorry, I think it's the other way around. So HCPC is basically our right to work. Yeah.
Yes.
which is
Yeah.
if you need to work in the UK, you have to have an HCPC license. And it's not just for speech and language therapy, they are for all allied healthcare professionals. So I think they cover about 11 or 12 professions.
Yeah.
The one that is the governing body for speech and language therapy, the guidelines we need to follow, the protocols we need to follow, that's the Royal College of Speech and Language Therapy, which is the RCSLT. So irrespective of you doing adults or children or whatever, you will definitely need to have an HCPC if you have to come to the UK and work. And then following on what your job entails, some of them choose to do the RCSLT full membership, some of them don't go to it. So
But that is
basically,
mandatory too.
RCSLT is more what gives us the professional indemnity insurance. So if someone goes through legal bits with you and you have the HCPC registration, RCSLT helps you fight them / all of these bits.
Kind
So
of
you also
keep
get
you covered.
CPDs. Yeah. However, there are some professionals here, like physiotherapy, where the governing body gives the indemnity insurance, but with speech and language therapy, you have to buy out an extra union membership. So for that, for us, it's Unite. So there's quite a bit of cost, but I think it is helpful, especially for someone coming from a different country, because you're still trying to learn the processes. It gives you a bit more security in terms of this is there if I have to fall back on it. However, not a lot of therapists do it because they're not asked of it, they're not required of it. I think especially I've seen a lot more. I don't know if you all think this is true. I've seen a lot more therapists working with adults who don't have the need to do it, but with children, they do need to do it. And in our trust, if you don't have the RCSLT competencies, which is what it's called, like a framework that you do it, you don't move on to the next bands. So you're stuck in the entry level jobs. So that's kind of how it is.
I can kind of agree with the fact that it's probably not listed as part of adult positions. I mean, of course, I can't say for 100%, but then I work in an adult setting and I was kind of only keen on working with adults. So during my job search and when they give the requirements of the job, just there's something called as essential and something else that's probably optional.
Desirable.
So in that, in the essential, you mostly have HCPC, and in the optional, you tend to have RCSLT because they don't expect you to probably come here. But at least in my trust, after you get here, they did kind of say that it's kind of important. So it's better you kind of get the membership. But yeah, thank you for nipping in, Swathi.
So there's also, I think it's nice to know because they give you 1 year where you finish your competencies. It can be more than 1 year if individuals need to take that 1 year. But that 1 year, you're under supervision from someone who is a member of it. And it basically, it is quite a long-winded process, to be honest with you. It is long, it is time consuming. It just feel like, why am I doing this when you've already seen and you know I can work? But it's also essential to understand the nitty-gritties of working in the UK. So it has questions that you have to reflect back on. It's all reflective practice and provide evidence on. So then again, this is why they take a stand and say, she's completed the competency, she's a fully certified member. So if like a stakeholder, be it a parent, a school, I'm only saying parent, school because I work with children. Of course, there will be other people. Whoever the stakeholder is has something to go against you, they will stand with you.
Yeah, I think just to add to that bit as well again, so I think what Swathi meant by speaking of supervision is, so this is only because it's not been a year since I got here and I have that 1 year window that I'm working towards at the minute. So at the minute, I'm a band 6 speech and language therapist, and I've got this initial 1 year period called the preceptorship period. So that's where they've kind of taken the RCSLT competencies and not my trust-based competencies and kind of equated that so that I need these competencies and just go on and about. So that's what it is. So it does keep me covered while I kind of find my feet in this year and get out and about. Yeah.
And I think it's also very different as to how one trust works from the other. So one hospital to other hospital, one department to other department, even though it comes under the broad spectrum of the NHS, which is National Health Service, it's really different. I have no clue as to what the private sector works as because that's not something I've delved into, but I know they have been now asked to do their competencies as well so they can support. So you can't take on students to to support their placements if you've not got your competencies. You can't go higher up, all of these things. And because private therapists also need to do that, they're now asked to, or I think it's become a bit more strict for them as well. So anybody who knows more about private, please pitch in. I know Athira wanted to say something at the start. I don't know if you had anything else to add, Athira.
No, most of the things were actually covered. So I was just planning to say about my personal experience with RCSLT. So when I was doing my masters, in between the masters, and I started applying for jobs. So I applied for HCPC first, and then I started giving the interview, and I told my recruiter that I'm in the process of getting HCPC. So as Swathi mentioned, like they gave me that condition letter telling that by this time, if you get it, like the job will be secured. So
Okay.
luckily I got my HCPC within the time frame. So once I started as a band 6 because I had experience in India. I straight away got a band 6 job, and there was another supervisor in my job, but soon as I joined, she left. So I was left all alone in the job, and like I didn't know what to do. But the good thing about the culture over here is you always get a supervisor, even if not from the same hospital. I got a supervisor from the community to help with from another community setup to help me with the RCSLT procedure. So when you start into the new job, if you want to apply for the RCSLT, you'll be first identified as an overseas qualified member,
Professional.
a professional OQP. So it will have a set of competencies. So
Okay.
you will get 1 year to complete it, and once you finish all the competencies, you need to show the evidence, and a supervisor has to sign us off from it, and we send the evidences to RCSLT, and then they make us like a full RCSLT member. So they always give us a 1 year or more than that too. So I just got it like last year. So it took
Yay.
more than a year for me because my supervisor left and I had to sort out that
Okay, okay.
scenario. Finally, yeah.
So is it like questions and like a lot
Yeah.
of things you need to describe
It's got
something?
about
Well,
7 to 8 domains, including like professional working, autonomy,
Okay.
communication, discharges, data recording and maintaining. And there are a set of subsections. I do remember this from my time. I don't know if it's changed. It was about 33 odd questions and I dreaded it. Uh, and for everything, you at least have to provide 2 pieces of evidence and then your
Okay.
supervisor signs it off.
Mm.
Yeah, it's not tricky at all. It's not to
Okay,
discourage
okay.
anyone because it's everything that we've done. What they basically want to know is how can you transfer the skills and knowledge you have from the
Into a
context
practical
in
setting.
India to context in the UK. So every question starts with in the UK context because
yeah.
they know and
Mhm. Okay, okay. Or did she get stuck?
Yeah, I was just gonna ask. I am not able to kind of hear.
Okay,
I think Swati's phone in there.
okay.
Yeah, so
I'm
just
really
to,
sorry.
No worries. Yeah, okay.
It's the snow that's jammed our cables since.
Oh.
Okay, we're back on. Yeah, it's just for them to make sure that we can transfer the skills and knowledge that we have. They acknowledge we have it, and
Okay.
then we do it. It's the same for anybody who studies in the UK as well. It's not just for us.
Yes.
So anybody
Mm.
who's studied in the UK, they do the newly qualified professionals competencies, which
Which
is the
Athira did,
NQP.
I guess, right?
No, I had to do the overseas qualified
Overseas.
because
All right, all
yeah.
right.
Anybody who studied outside of UK has to do the
Okay.
overseas.
And
Anybody,
okay, yeah, sorry. So
yeah,
another
yeah.
question
No.
is HCPC. Even Athira had to do HCPC. Is it like
Oh yeah,
everybody,
yeah.
even though you
Everyone needs
Everybody has
HCPC
to do
education.
HCPC no
even if
matter
she's done
what.
her master's in the UK?
Yes.
yeah,
Yeah.
All right.
Everybody in the UK also have to have an HCPC.
it's about
Okay.
having so HCPC does give you the license, just
Mm-hmm.
RCI. So it's a license to practice as an allied health professional, be it a speech and language
All right.
therapist, a therapist, or whoever it is. It doesn't matter if you're from the UK, outside of the UK,
You
you need
have
that
to.
license
Okay.
to practice in the UK. Yeah.
All right. And is it so you can do it sitting back in India as well? You can, it's just an
You
online
can, yeah.
thing.
Yeah.
Okay. All
And
right.
their website is really well detailed. Like they have a
Mhm.
step-by-step guide. So if you just follow it to the T, you're really sorted because they have given everything possible.
Mhm.
They are really prompt with their emails, and if you can afford to make the international calls as well, they are quite prompt with it.
Mhm.
So if you ever feel like I'd rather say call and check or email and check before you send it and get it rejected,
Mhm.
because they don't reject it. They will ask for evidence. It's exactly like our visa application. If I have to be, if I have to compare it with something,
Okay.
you have to submit all the documents. They'll make sure and scrutinize it. If there's lack of evidence for something, they'll come back to you
They'll
and
ask
say,
you for more. Okay.
can we do this before they reject it?
Okay.
I don't think I know anybody from India who's never had an HCPC. It's been very straightforward, I think.
Mhm.
Yeah, and just to add to that, I think about the timeline bit, what's given on the website is 90 days, 90 working days, or 60 working days. I'm a bit unsure, but it's definitely clear on the website. And there might be a bit of a delay in their response, but the best thing that I'd suggest, and second what Swathi said, is email them. There are priority email IDs, there are international specific email IDs. Find them on the website, ask them for your status updates, or give them a ring, as she said as well. There might be other information that people find online, which I did when I was trying to apply, is do not ring them, do not email them. You're only going to put your application back. Don't follow up with them. But I just did what I felt like, and it was really helpful because at the earliest, if you email to their priority address that's given there, they do get back to you within 5 to 6 working days or so.
Okay.
So you don't have to sit there just boiling in your head thinking, am I getting it? Am I not getting it? Because sometimes just the fact that they need additional information from you might delay your application. So maybe you emailing might be helpful to get that information sent out earlier if they need any.
Okay.
And also, I'd say put as many details as possible, because this is their way of knowing, have you had the equivalent education or experience or training that the students in UK have had. So don't miss out any opportunity to list everything you've got, be as detailed as possible. They ask for professional experience as well, so try and elaborate what you've studied, what you've applied, what you've learned as well. The course information form, again, is quite long-winded, but that's basically the point they will look for. Again, not to say that if they see there's gaps in something, they don't immediately reject it. I know according to the website, they say we'll either have you do some competencies or apprenticeships. They also say we will do an assessment skill test, but like I said, I have not known anybody from India who've had to sit for it or do it. I think we have got a really lovely theoretical knowledge and strong foundation base. Like I said, I don't know in my experience, anybody who's not got their HCPC. It takes time, it takes money, but it'll be done.
Yeah, it definitely will be. And that's only because I know after I came here, there have been a couple of my juniors who've been trying as well. And I've been trying to help out a few of them. And the only thing is either they get a delayed response or they are requested for further documentation. And in terms of documentation, like Swathi said, just try and give everything you know. So it's this thing, right? Like when we had a Vivas probably in our uni time, and it's all about showing them what you know and not being scared of what you don't know. So just give them everything that you know, additional stuff for everything, and keep it all covered. I think it should be much straightforward.
Okay. So the other question is it, you said it's expensive. Approximately how expensive?
55,000 or 50,000. I think initial
Mine's
payment
been a while
was,
ago as well. So yeah, I'm not quite
mine
sure.
was also like, I think
The website definitely has it.
Okay,
It
fine.
should
All right.
reflect on it. But I think
something around that. I think it
Okay,
comes.
fine.
yeah,
I think you initially, while submitting the application, or I'm not sure,
there are
there
two
is
fees
about
assessment.
like so there is a scrutiny fee
Scrutiny fee and the processing fee.
Yeah, so the scrutiny fee, I think when I did, was about £495 or £469, so somewhere around 50,000,
Okay.
50 to 53,000 Indian money. And when you've got your acceptance, then there is the application or the registration fee in the end that you pay, which translated to me for about like 20,000.
200, yeah, 200-ish.
200
Okay.
pounds.
And you have to renew it every 2 years. So you have to
Yes.
keep giving the money every 2 years. Around 20,000 every 2 years. Yeah.
Okay, fine. All right.
And also, I think it's just, again, the course information forms and things like that. You will have to go back to your universities.
Yeah, and get
And if
that.
it's bit backdated, I think
They
that
will
adds
ask
on to
you
the
for
cost
money.
as
Yeah.
well. And I think that's different to different universities and
Okay.
institutes. But
Yeah.
And
there's
doing
that
it
bit as well.
attested as well might be, if you're
A
going
paid thing. Yeah.
lottery to do it, then that's gonna charge you.
Mm.
But
And then the
uh,
IELTS fee as well, because you
yes,
have to
Mm.
prove that as well. So
So
the IELTS exam.
HCPC itself requires IELTS score as
Yes.
well.
yes,
Okay. Okay. So all of the requirements are on the website, right?
Yes,
Yes.
it
very
is.
detailed, very thorough.
But one thing in respect to IELTS that I kind of had a catch was trying to write the IELTS UKVI and just the IELTS General or Academic. So I basically wrote IELTS General. So if you're very keen on just getting to the UK, I'd say just write IELTS UKVI, because for your visa, when you get your skilled worker visa or the health and care visa, for that bit you again need to provide your English language proof. So there what was listed was you can either give your IELTS UKVI or you can give something known as the ECTIS or other English language proof. So I had a bit of a catch there because I had given only IELTS General, not the UK visa and immigration version. So I had to take ECTIS separately and kind of give like two things for my visa. But for the HCPC, the IELTS
This
version.
was okay. Okay. Okay.
So for anybody who's watching and who needs like only UK, who only has UK as a goal, just go ahead and write general or academic UKVI version.
But if you are applying, like you said, Meghna, if it's not just for UK, take the IELTS that would go with
Yeah. Okay.
multiple
Okay.
license requirements, because ECTIS is straightforward. You have to just provide a certificate that says your medium of instruction has been English. You send it to them. I don't remember how much it costs. It is not too
For
much.
30,000 Indian money, I think.
Mhm.
But so that is for getting the certificates in about 10 days time. That's how quick you can get it. But if you want it like a bit more quicker, you've missed it and it's your visa time and all of that, you can get it within about 2 to 3 working days as well. But that's going to cost you extra money. But I think
you
about
have
30,000
two options. Either it is online in a PDF form or a
Yeah.
paper
Post
document.
as well.
If you
Yeah.
can, go
Yeah.
for a paper PDF format. It's much easier and you get it immediately. I think you need to submit your medium of instruction and transcripts. You need to upload your transcripts to get that. So I think it was 20,000 for me when I did it long back.
Mhm.
Yeah, and you need to upload your transcripts, college transcripts, and transcript is the marks card and not the transcript which
Mhm.
take from university. So it's just the marks cards you need to
Okay.
semester you
So,
need to upload on
yeah.
the website.
But again, to just give a picture of what ECTIS does is, like Swathi said, it's very straightforward. And what they're going to do is basically equate whatever you've given to their standards to say that your
Okay.
English is quite enough for you to enter the
Work. All right.
and things like that. So that's
Okay.
just going to be a certificate that you're going to get.
Okay. Okay, so I think we have good information about HCPC and all the registration. So I want to talk about jobs. You told me about recruiters and how do you apply for jobs? What is the process like? What's the recruitment like? Maybe we could start with Swathi.
Again, I think mine was a bit unconventional. Sorry.
No worries.
I started looking, and I was very particular about only looking at NHS jobs because, like I said, I was quite happy with where I was in India. This was more like a next step in professional development or experience that I wanted to see. And it just made sense to have that security that I was working for the government in a new country, in a new place. So I didn't even look at anything private. So when I started looking for it, I just went on the NHS jobs website, which lists all the jobs possible in the entire UK, which includes both the Wales and Scotland bits, but they will then read out to NHS Scotland, NHS Wales, because they are different countries, even though they're UK. And then again, they've got different filters. So I was looking at equating what's the next step, because I worked for about 7 years in India. What do I want to do next, or what do I want to do after this? So I was looking for band 7s and band 6 jobs.
Okay, band, just before I want to interrupt. Band, what do you
Yeah,
mean by
so
band?
pay scales here are divided as different bands. So
Okay,
with
like
each
grades or
band,
something. Yeah.
yeah, exactly like grades, yes. And with each band comes a set of roles and responsibilities that's specific to that. So band 3 is where the speech and language therapist assistants start with, which is like the entry point, and you don't need any of these professional
Okay,
qualifications.
okay.
Band 5 is on where you say a lot more direct professional work is involved, for which you need minimum qualifications. So with band 5, the majority of caseload is clinical, and you have very little research or leadership opportunities. With band 6, you can say about 80% is clinical, and then the rest 20 gives you opportunities for
Okay,
research, leadership, and all of those. Band 7 goes into the more managerial bits, and again, depending on what hospital, what trust, what it varies
okay.
depending on different bits. There are few niches here, so something like dysphagia, and I'm speaking only in terms of children, so anybody else who has got perspectives from adults, please chip in. Dysphagia is a niche, AAC or complex children
Okay,
is a niche. So there are some regions in the UK which might offer just clinical roles for these.
okay,
The autism pathway, like Asha suggested earlier, that's quite different as well. So there will be just assessments for autism, and that can sometimes come in a band 7 job.
okay.
So these niches or specialisms have just clinical band 7s as well, but anything else mainly also comes with the leadership roles with it.
Okay.
So I just looked into pediatric, band 7, band 6, that was my filter, and places I had heard of. I don't want to sound stupid or ridiculous, but it was just because this
It
was
makes
just
sense, yeah.
this was what made sense to me, and it was not because I wanted to get out. It was we'll see what's out there situation, but it might be different for someone else who's coming here looking for a job for different reasons. But I know there's LinkedIn, Indeed, all these other websites as well, which has got jobs. I know there are private agencies that do recruitment as well, but I didn't take any of those routes. For me, it was very straightforward, direct recruitment through the NHS jobs
Okay.
website.
All right. Meghana?
Yeah, so it was pretty much similar. Like, I mean, I got my HCPC and then started looking for jobs. I did not want to even try before because I was happy with my job at that point in time in India and doing what I liked. So after getting my HCPC, I went on to the NHS jobs website, just like Swathi did. And it was like, there are a couple of divisions in the NHS job website. So there's something called track, there's something called NHS jobs, but simultaneously, if you just look at it, what you might find is the same job listed in both the places. So it's all right where you look, it doesn't matter. And just like Swathi said as well, if you're looking at other platforms like LinkedIn or Indeed, what might have happened is there might have been listings, but these listings, when you click on them, are going to take you again to the NHS website. So these are some things that happened to me. So what I was personally looking for is to, again, continue working with the adult population and to just give a picture of what working with adults looks like in the UK. Of course, there is neuro that we all tend to practice back in India. Well, it's quite similar. Then comes the division of acute and community. So acute is basically more like hospital settings, and you do more of inpatient work. And community is more like outpatient clinics or like doing home visits or visits to nursing homes here or care homes and things like that.
Okay.
So that's how it is split. So in terms of specialties, again, here it's divided into neuro. There's you could work in a cardiothoracic unit. You can work along with mental health as well. So here there's a separate unit under the mental health, which is known as the learning disabilities, which includes working with population who have autism or any sort of learning disability, ADHD, and things like that. And dysphagia is a particular specialty as well. You get to work in long COVID clinics, so on and so forth. So this is more like a wide range. So you can go as specific as just working with the ENT for voice. So that's how specific it is for adults. Yeah, but it's pretty straightforward. Again, you just look for jobs with the keywords. Just see if you have any specific locations where you want to work at and search and find them. For me, particularly, I was happy with NHS, so did not look at private because it is indeed the security the NHS offers as you land as an overseas talent
Newly, yeah.
is definitely
Yeah.
yeah. So that's it's pretty similar to what you
Okay.
mentioned.
Does it take a long time for them to get back to you and for you to like apply and all of that?
Yes. So the applications, yeah, as soon as you start them, you might find yourself having to type something called as the statement of purpose, or
Yeah.
like kind of going around how your experience matches to what's required for the job position.
Mhm.
So as long as you have that sorted, or you have like say a base to kind of modify for every other job that you're looking at or position that you're looking at, I think it shouldn't take you that long. But the applications are a bit lengthy, so it
Yeah.
might take you a bit
Okay.
to get through it. And in terms of how they get back, it is a bit of a process. You might have a waiting time for that, which is a couple of weeks.
Okay.
Yeah.
It will be, I think, when you're looking for jobs, just off the back of it, at the bottom, it should mention that there's a certificate of sponsorship that the job offers, which is basically how we get our visa. So if it doesn't say that, then there's probably lesser chances of them hiring an overseas
Overseas
candidate,
person. Okay.
because the trust probably does not have enough funds to bring us here, which is what they have to do, pay the money to get us here. So it might be worth just looking at if that's available, because that's something they will also. I found it helpful to ask in the interviews to just reassure myself to say, will you be able to provide this? Because I've seen this on the job description. Because otherwise there's no way for us to come and work here for the
Okay.
NHS, basically.
And
Also, just, oh, sorry.
Athira,
you know,
yes.
it's all like, it's
No,
fine.
I just wanted to say, because I thought it might be helpful to know with children, working with pediatrics, you can work in an educational setting, which is where you be a school-based therapist, and that can be mainstream schools or nurseries or specialist schools. You can work in justice systems, which I haven't firsthand seen, but have had colleagues who worked from there, and I think Asha's observed some bits, so she might be able to pitch in later, which is basically working with children and young people who have special or communication needs, and we need to
Okay.
help them navigate the justice system, or children's services, and that again can be hospitals. A lot more acute work would be dysphagia clefts, or anybody in the hospital who needs immediate care are worked with the acute team. The moment they're discharged from hospital, it comes to the community team, who might
Okay.
then choose to work with schools or nurseries, home visits, clinics, however that trust
Okay. Okay.
offers that support. All yours, Athira, sorry.
So, I just wanted to comment on the time frame, like from the point of application for a job, from the interview, and finally getting a start date for me. Personally, it took around 3 to 4 months, even though I was in the UK at that time. So I applied for the job. The interview call was quite quick. So
Okay.
following the interview, that's when it took a lot of time. So
Oh.
like they had to go through a lot of documents, and I had to give a police clearance certificate. Then we needed something called DBS, which is basically they'll check if we have a criminal history back in India or over here. So there's a bit of process that they go through. So for me, it took 4 months.
Immunizations.
Yeah, everything. Yeah, because I didn't have my immunization certificate from back India. It just got lost. I had to go through all the immunization again. So we had to do all these things before we can start the job. And I also know one of the dietitian who joined almost the same time with me. So she was also an internationally recruited person, and she was back in her home country at that time, and she applied for the job. It took almost a year for her to get the job and finally to come to UK. So the time does vary, and it just depends upon the trust where we work and how prompt the HR team is and everything.
Okay. Okay.
My time frame was very similar to yours, Athira. So I got my interview in April. I got the result the same day, but by the time I got my conditional offer letter, it was May. And then I started my HCPC because I hadn't anyway. After that, I came to the UK in November 22, and I didn't join work till December 12th, 22 because of immunizations, preoccupation checks. So again, I was blessed to have friends who were able to support me financially here, but that might be something to consider for others if you wouldn't know anybody, that it takes quite a bit to get started. However, I've just had one of my friends join one of the trusts in the south, and she is doing her work, observing and shadowing while they're doing all of these for her. So that's really nice that they understand it, because it
Yes.
takes a lot of,
Okay,
it
okay.
needs financing, isn't it? You've come from a
Yeah.
different country. If you're not getting paid, that's quite a
Yeah.
tricky one. For me, it was almost a month and a half before I started.
Yeah, I think just to add on to that, it was quite similar for me as well, because just like we initially pointed out, each trust functions very differently. So there might be a lot of induction period where you have to undergo a couple of trainings and
Mm-hmm.
trainings to kind of understand the system as well better, different policies better. So in that period, you will have time to kind of shadow different people, different specialties, to understand the team, to understand their way of working and the documentation and things like that. So it did take me about a good month and a half as well to get up on my, just start seeing. But one good thing, I think what initially Asha mentioned as well, or Athira, I'm not sure, the people here are really nice. They will support
Yes,
you from day one and till you continue.
absolutely.
And if there's any point where you are kind of having a hiccup, or if you feel like more time, all you need to do is just like kind of voice it out, because
Yeah.
if you don't voice out, you're not gonna obviously understand. So just to kind of be flexible in those terms. Yeah.
Okay, okay.
And I would also like to, because I work with the workforce lead in our trust, and they're looking at international recruitments and how to change it. I like to believe that a lot of other trusts are also looking into how to make this process easier, how to support with pastoral care when we start off with. So I think they're also getting a lot more candidates internationally and overseas.
Okay.
So they're also trying to look into how to make that better. But yeah.
Okay. Okay. So
My recruiting process was entirely different from everybody. So I attended a job fair through government thing which happened in Cochin.
okay.
So in Kerala. So I never had the plan of applying for UK, or I never didn't want to do anything. So it randomly came up. So I went and attended. So it was contacted, like government was just bringing them up or something. That so it was called Norca routes or something
Okay.
in Kerala. So it happened in Cochin. So uh, so there was a team of different doctors, nurses, psychiatrists, psychologists, PT, OT, speech therapists, so many different professionals from different trusts came over to India to
Okay.
a recruiting process. So yeah, it was a week program. So different days for different people. So I randomly went and attended this. And yeah, I got interviewed by a speech therapist and a psychologist. And yeah, that's how I attended, got the job. Then when they get back to you, you have a time frame to apply for your HCPC and do stuff. So once I got the job, I applied for HCPC. So I think I got recruited in January or December end. I came here in July. Yeah. So
Okay.
because I had the time frame to apply for HCPC
6 months, 7 months. All right.
So
Yeah,
yeah,
just
process. And for me, I never paid any money. So everything was by them. So they booked my flight tickets, they booked my accommodation. I got 3 months of free accommodations, lot of things compared to Swathi, because at that point, Swathi was the only speech therapist I knew, and like we worked together. So I
I was
was
happy you got it though. It was never like, oh my God, you got it. But I also think, did you have a contract?
Yes. So it says like if you leave this job, you need to pay this much, and so it when you get the unconditional or conditional offer letters. So it I think it's different for different trusts. So usually they don't do all trust does not give this provision to all allied health professionals. So usually it's for the nurses and other professions who get the free accommodation and trust. And I got my visa money back, everything I got pay back. So
Some jobs do have a reallocation bonus as well. I think it depends on, again, it gets tricky. It can be looked into two ways. It can be that the trust is doing really well, they have money and they can give all of these benefits. Or for some reason nobody wants to take a job in that particular region
Mhm.
because there are those regions in the UK that we're all aware of,
Mm.
and they will entice you to take that job up. So there's multiple things in that equation there. It might be also worth looking into where the job is
Mhm.
and their websites,
You
because
have an
sometimes
option to go and visit if you get, so in the
Yeah.
job description, or when you get when they say you're recruited, you have an option to go visit
Okay.
the team and stuff like that. So if you want to go and meet the team and manager and see how they do function and all those things, you have an option to do that. So, or before the interview also you can do that.
Yeah.
If you are in the UK, you can do only that if you are in UK. Definitely, if you're attending it from India, you cannot do that. Like over here, it doesn't make sense. So yeah, you can
Okay.
think
Yes,
so.
I went through that route actually because when I was interviewing, because it was a mental health role and I didn't know anything about what a speech and language therapist do in a mental health role. So when you see the job description at the end, there will be a contact detail, like it might be the email or contact number of the senior as a speech therapist over there. So I did contact them and I asked them, can I come visit your service before I apply for the job, just to see if this is like a if this is a job that I'm looking
Fit
for,
for me.
just to meet the
Yeah.
team and greet. So they really welcomed me. They were really open about it. So I went there, I met the team, I got to talk to the speech therapist about the patient population they see, the test materials they use, and that really helped you with the interview as well. So because like I was able to make that connection with the speech therapist and the managers over there, and they, after I got the job, when I started, they did say that, like, for me to come and see the service and to take that step, that really matters when they interview you, because that shows that you are taking
Yeah.
an
Commitment.
initial step and you're taking that effort to meet the team, so that will help you in the interview as well.
Okay.
I
Okay.
don't think a lot of people choose that because like I think there's less awareness, like you have an option like that.
Yes.
Either you're not in UK, that's another thing.
you have
People know
annual
that.
leave.
Yeah, another thing. So like I got to know and I saw this, but like when I interviewed, I never knew about this. But when I was here, my clinical supervisor or my colleague was applying for different jobs. So she said, "Oh, I'm coming late and I'm gonna do this." And I'm like, "Can you do that?" And she said, "Yeah." She did spend a day with them to get an idea on those things. So that's
Okay.
definitely a point
Yeah.
when they interview, because nobody choose that. I think like nobody puts so much of effort going in. Either if you're looking suppose you're working, I mean, working in Liverpool and you're applying for a job in London, it's not possible for you to travel all the way like 5-6 hours to London and go and see all the stuff. So yeah.
Okay.
Also, I think like how Asha was saying with the job fairs, so a lot of, like Asha said, nurses, radiographers, all of them have for a long time got jobs like this. And now I think eh, I can't remember if it was HCPC or someone else who's looking at trying to get speech therapists as well into recruitment through these processes. So we have now gone on short occupancy list in the NHS. There's a huge demand and need for speech and language therapists. So they're looking at different options to see how they can bring them in, because this has been in practice for I can say occupation therapists, radiographers, a lot of allied health professions like this. But we've only recently gone on the short occupancy list. So I
Okay.
think the recruitment process for speech therapists still in the works.
Okay.
But
So
yeah,
yeah, that was my next question. Is there like a big need for speech
Yeah,
therapists
there's
in
a
the
huge
UK?
need.
Yeah,
Yeah.
Okay.
huge need.
So if
massive,
you would
massive
say
need.
this is a need across all roles, because I think a lot of you mentioned about adults, children, community, all of that. Yeah.
I'd
So
say so.
yes. Yes.
I'd say there's quite a lot of opportunities for both, isn't it?
Yeah, there is. I think that's also because like we've all got waiting lists here, and there are
Mm-hmm.
people who need the service. So that means
Mm-hmm.
the bigger the team, the bigger they can offer as
Yeah.
well.
Okay.
So yeah,
And especially when it comes to mental health setups, like I have seen like a lot of speech therapists doesn't choose it because it comes with its own challenges, because it's not very pleasant to work in a mental health unit. You will be witnessing self-harm incidents and it'll take a toll on your mental health as well. So, but it has its own benefits as well. So I've seen a lot of people from the UK, like people from UK, I have not seen a lot of them applying for a mental health role.
Okay.
So there's always a need for speech therapist in such roles.
Okay.
So I got selected now, and now one of my senior, like the band 7 speech therapist, is also from India. And we had a role which was almost vacant for 2 years, and we couldn't find anyone for that. And recently, last week, we got a candidate for that. And so there's a lot of
Out of
opportunities
curiosity,
in
who
mental
took the role? Sorry.
Sorry?
Out of curiosity, who took the role? Was it someone from the UK?
Yes. Yeah. That was someone from the UK. But in my role, so when I started, I applied, and I think because it was mental health setup and there's no enough candidates applying for the job, I think that was one main reason why they gave me visa without any issues. They were so happy to sponsor me because
Somebody's
they yeah. And even for my supervisor who joined recently, even she didn't have any issues with the visa
Okay.
procedure because we really needed them. So there is actually a real shortage in the mental health
Okay.
field as well.
So if you would love to talk about what your role is, what do you do in your job? I would like to ask everybody, but it's pretty interesting to hear about this in a mental health setup.
Yeah. As I said, when I first joined, I had no clue what to do with mental health patients. But then we are slowly developing our service because even within the UK, the role of speech therapist in mental health unit is slowly progressing, and it's like slowly like getting like everyone's getting to know about it. So basically, what I do in my current role is I do mainly it's dysphagia because the incidence of choking and death in mental health patients is really high. So in our hospital where I'm working now, there were 6 deaths previously. So that was a main reason why they wanted a speech therapist for the hospital. So my main role is from a dysphagia point of view,
Oh,
like
okay.
assessing and management of dysphagia patients. But it's quite different from what we do in an like in an acute stroke unit or anything. Like we can give swallowing exercises for like the general population, but when it comes to mental health patients, like they won't do any of the exercises, and it's really hard to make them understand that they have a dysphagia. Like they will not be agreeing to it. They have all these behavioral challenges, and their medication side effect can cause all these dysphagia. So mostly our go-to management option is diet modification, because none of the techniques, none of the exercise, it doesn't work much. But we try wherever we can. We do try to do all those things. And then another thing I do is we have a dementia ward as well,
Okay.
and I do communication assessments.
Okay.
So I have one dementia ward, one older adult ward for other patients with mental health, and 5 adult, like the not adult, from who the age range would be from 18 to 60 years in those adult
Okay.
wards.
Okay.
So main thing is communication assessments and providing some few management options. Like our conventional speech therapy won't work because it'll be hard to build a rapport with them most of the times.
So
But
it's a
most of our
hospital.
yes. So
So you
most of
don't see them regularly. Sorry. You don't see them regularly. It's just like a one-time thing, and you ask them to follow
no,
up.
like they get admitted there for their acute mental health
Oh,
episodes. So
okay.
they might
Okay.
have like a breakdown. So they will be there in the hospital for quite like few people
So,
leave within 2 months, but
yeah,
some
so
would
there's different sections when you get to
sections.
the hospital. So there is section 17, there is different sections. So depends. So maximum the hospitals will have is 20 beds per ward. So
What?
there is different wards. There's PECU, which is psychiatric inclusive
Intensive care
Okay.
unit. Yeah.
intensive care, and there is female wards, there's male wards, there's mixed wards, there is geriatric wards, there is eating disorders. So everything comes under this mental health setup.
Okay.
So there is different sections which, so if you are under section 17, you can go out of the hospital. So if even if you're admitted in the hospital, you can
Okay.
go out, just go to the shops, get something, spend few hours without escort or something.
Okay.
If there is high chances of absconding, or if the patient is very vulnerable, you wouldn't be. So it
Okay.
depends
Okay.
on what section you are. So
Okay.
usually patients does not stay in the hospital like more than a particular days. So like you get treated, then you move into a
Oh, yeah.
secured home or a rehabilitation center, or you
Mhm.
get back to your home, or it can be anything.
Mhm.
So if at all you don't want to go back to your home, they would then look up for funding and provide a secured home or a care, not care home, but it's like a
Supported living environments for them.
Assisted living.
Okay. Okay.
setup. But you
Uh,
need to suppose if the patient is not ready to leave, there might be patients who's been staying in the hospital for 2 years, 3 years, because the
Mm.
patient doesn't want to leave. So everything
it
is on
depends.
the patient. If the patient doesn't want to do it, you cannot do it, or you
Yeah.
cannot force it.
There's no,
So
you can't force anything on any patients over here. That's where our hands are really tied.
I think that's the reason why there's a lot of self-harm and there's lot of suicides. So even my hospital was under, case and all those things. It was very viral on social media, TikTok and Facebook, and we've got a lot of media attention at that time when the case was coming out. So it depends upon. So they wouldn't. So if you know the child patient is vulnerable and do suicide, but still you wouldn't remove those items from the patient's room because
Mm.
you're violating the patient's rights. But so they would ultimately end up suiciding or doing something. So it's very different. I didn't like, it's my perspective. I didn't like the setup. I cannot take this at all. So yeah, and I've been into forensics, which like Swathi said is justice. So it's very different. And compared to what Athira said, my job was different. So we need to
Mm.
provide communication passports for the patient,
Yeah.
which has the patient's interest, or what are their
Like a one-page profile.
diagnosis,
Yeah.
what is their communication needs, or what are their interests, what do they like, what do their peak hours, and so many different things includes in a communication passport. So you can do develop a communication passport with
Okay.
the patient.
This is for people with mental health issues?
Yes,
Okay.
in
Yes.
mental
Okay.
health. So yeah, and you might go to MDTs, which is multidisciplinary team meetings, which includes nurses, psychologists, psychiatrists, dietitians, PT, OT, and newly they've started I think including speech and language therapists, because it's very hard. You need to find a feet around it, and you need to prove that psychologist or psychiatrist doesn't want to get a speech input, so they might say, oh, we don't think there's a speech input, we don't need, they think.
There's always a space. There's always a
Oh.
need for speech input.
So they were like, oh, you don't have to do that, or nurses might not be. So it's very understaffed when you go into the ward. So it's very
Mm.
difficult. You need to go for report outs where they discuss
Mm.
with the patient what happened in the previous day. So it's very different. So yeah,
Mm.
my trust usually like what they did was like develop a communication passport or identify patients who need communication support. So spend time with them and develop a communication
Yeah.
passport, or it's not like a very conventional speech therapy job,
Mm.
to be frank.
Yeah.
It's very different, and you might not do dysphagia, you might not do dysphagia.
Okay.
uh yeah, so that's what I have
That's
done.
Just
different.
to add on to that, like in my current role, like we do communication passport, and recently we have started doing communication groups as well. We are just trying to improve that pragmatic skills of
With
patients to
each
make
other.
to improve their social communication skills. So I have recently only started for dementia ward. I do a reminiscence group every week, and I do a few memory groups, just like a cognitive memory groups. So just few groups every week. And another main responsibility of my role is training the staff. So I conduct dysphagia training every month for the staffs and like anyone who comes in the care of the patient. So we have
Okay.
to
Okay.
train, and that's also a main part of the role. But as Asha said, it's not like the conventional speech therapy that
Sounds
we
so
do.
Correct.
It's
different.
really
Very
different.
different. And it's very different because like I said, if you're not known to this stuff, so when I have experiences where, so like mine was a very difficult setup,
Mhm.
and as a whole, like patients never get discharged and they've been there for a long time, so they would be emergency or higher directors and people coming into the wards and asking why there's no discharge. and why there's no patients doing it, and it's always understaffed. So 20 beds, and there might be like one healthcare assistant and 2 nurses. That's it, and a service manager or a matron or a.
Mhm.
So it's very difficult. So it's like people will be coming in, going, and there will be like a lot of incidents.
Yeah.
Alarm happening on one side, you need to go inside, control the. It's very
This
difficult.
is
It's
where
too
Oh,
much.
this is where it's
chaotic.
important to look at not all trusts work the same. It
Yeah.
depends on your region,
Different.
depends on how much funding that region's
They
getting.
have.
Mhm.
There are massively underprivileged areas, like Liverpool's one of the underprivileged areas, even though it's got a lovely name. So how much
Mm.
funding the trust is getting, because that depends, that decides staffing, that decides resources.
Okay.
Yes.
It's
Ours
so
is
it's
like
Lots of
very
connections
fairly
different.
there.
staffed setting, so it's fine, but it's just there's never a boring day at work because of all these things happening. It's always
There's a lot of entertainments, to be frank, like not in a bad way, but you would
But
see different things.
Okay.
Like when I went for report outs, because of this emergency situations, they've asked me to do nursing job, and I'm like, I have no idea what's. So there's a big board with 100 columns, and you need to put it as amber, green, and red. I mean yellow. So you need to change each patient, and I'm like, I have no clue what's on this board. And because you're a speech and language therapist, you cannot say that you don't do this. And I'm like, I don't do this. I don't
yeah.
know what's happening on the board. I will not do this job. So
I
they
think
will
it's
call out
really,
you,
yeah.
and it's very different how it works in
It's
different.
important to create those boundaries, like I am a speech therapist, so this is
This
what
is
I'm
all
going to
I
do.
can
So
do.
because
Yeah.
especially in mental health, they don't really understand the role of a speech therapist and
Mhm.
where the boundaries lie. So once you say, it's really important to set those boundaries in
Okay.
certain roles. I don't know how it is in other roles, but in mental health, yes, you need to set those
Very
boundaries.
difficult. At times you need to tell them that I can help, or I can do this for you, or I can when especially like my psychologist, the psychiatrist doctor was like very strict. Oh, I don't think there's a salt input. And I'm like, we need think there is a salt input, and you need to tell why you think there is. And yeah, but they, because it's very like a new role, and
New
people
role.
don't
Correct.
know
Correct.
what
Yeah.
they particularly do in
Hmm.
mental health setup. So you need to prove that you are trying to help, and you're
Okay.
doing good
And
things.
Are you
And I
still
think
in
it
this?
gets tricky. Sorry, I
I'm
said
sorry.
I wanted to say I think it gets tricky because you're also flying solo then if there's one or two people only,
Would you
you
be the
are
only speech
basically
therapist there? Usually?
My hospital, it was just once band 7, and there
Mm-hmm.
was 2 others. Like there was another girl who came along with me,
Mm-hmm.
but there is 6, 7 wards, so you need to
It's
go
not
in.
enough. Yeah.
You cannot
In
go into
in my
each
setup, like
ward and do stuff.
when I joined, there was a band 7, so then I joined, so it was two of us for 2 months. Then she left, then I had to do the job on my own for for almost a year, and then I got my supervisor, so now it's just two of us for 7 wards now.
Mm.
Yeah. It's
Now I
It's
massively
understand.
difficult,
important.
Yeah, I understand when you
very
say there's a
difficult.
huge need.
Yeah.
People does not take up the job, especially in mental health setups, I think, because nobody knows. Like even I had no clue when I came, and I'm like, what am I doing? Am I doing
Mm.
what I'm supposed to do, or am I doing this? Should I do, shouldn't? I am like, so yeah. And I've done
Okay.
forensic also. Yeah.
What is that? Can you tell us a little bit about that role as well?
So forensics, or it's secure, it's called SIS, secured inpatient
Okay.
care. So which is mostly like people who are under criminal or with some criminal background, and put under, they cannot go back outside,
Mm-hmm.
or they cannot go back to a secured home, or because of their vulnerable conditions, and because they have this background,
Mm-hmm.
they cannot be punished also. So they end up living in this
Oh, okay.
are secured inpatient setups. So you can, few people would get speech therapy input. So it's very different, and it's like very difficult to go inside.
Mm.
You cannot carry anything. You need to remove your watch. You cannot wear like you cannot have your phones. You need to put your phones inside your locker, and it's very secured. you don't see the patient direct. So there's a mirror,
Oh,
and
okay.
it's not like jail. I wouldn't say it's called a
Okay,
prison
Some
or
okay.
of them do have to work in prison setup-ish.
Yes.
Mm.
Some of them do
So
have to
But
do
what
there
does
that.
an
is
SLP have to do here?
support with their communication needs.
Okay.
Again, that is very different. They might have mental health problems, and they might have other communication.
Mm.
So at times we might need to advocate for them or tell that because of the
Okay.
speech and language needs, they're not able to communicate. They're not
Okay.
have not done this crime, or they have not done this, or support in all those aspects. But it's very different,
Difficult,
and it's
right? Yeah. Yeah.
so there should be a patient readiness to work, and they don't. It's compared to other setups like inpatients, like how Athira said, they engage in different jobs. So they might do some carpentry, they might do. So it's very nice to go inside and see, like if you get a chance to observe or shadow. So I've done so many things like this. So I've got like
A bit
so
of
many
information. Yeah.
different, yeah, different places. So I've tried out everything.
And now you
So
know what you like, so that's a good thing.
yeah,
So,
so I know what I like. I went back to pediatrics, which I like to do. So
okay.
yeah,
So
it's
you
very
are,
different.
so currently you're in a hospital-based setup or a clinic-based setup?
No, I went back to pediatrics. I don't want to do any of this. So yeah, I'm doing school based. So I'm a community like Swathi, but I don't do clinics. I do clinic setups just to do initial EHCP and assessments.
Okay.
So EHCP is like a healthcare plan, like IEPs in US.
Okay, got it, got it.
So there's a plan for the kids who need special or specialist provision. So yeah, few initial assessments in clinics, or when the school is having a summer holiday or a break, I might do end up a block of therapy or something in clinics, but
Okay.
I don't usually see
So
much of kids
predominantly schools and
in
younger
schools.
population.
Yes, it's I go to secondary special schools and few like secondary schools, but mostly it's primary and nursery.
It's not one school, is it like a bunch of schools you
I
have to
go
go
to
to?
11 different schools.
Okay. This is one
And
day,
that's why
one.
you will see it's easier if you have a car to get to places
Yes.
rather than public
Oh,
transport. So when I was applying, there were jobs that would outrightly say
you need a,
UK driving
okay.
license mandatory, but
Oh,
now it's against the law because that's discrimination. Because we've got the skills, but we don't have it. And
oh,
if I
okay.
can choose to use public transport to get to my places, the employer shouldn't have a problem with it. However,
Okay.
it's not an easy job.
Yeah.
Okay, okay.
Yeah,
So,
but I think it also depends on the trusts as well, again, because like I was recruited for a community position as well, and I still don't drive in the UK, but I am okay to go about and do some community work through public transport. But it also depends on your team if they're willing to be a bit flexible, and especially in the community, they do offer clinics at some places, and they some teams only stick to home visits. So in that case, you might be in a bit of a fix, but if not, it can remain flexible because I only do clinics and community wards at the minute. So it's still been okay for me.
oh, okay. Swathi got
So
disconnected. Okay.
I
All
think
right.
a few trusts are flexible, but ultimately, like I don't know, like Swati's trust never, like even I never had an issue like that, but they would bring it up in appraisal. When you go for
Yes.
appraisal, they would bring it up. This
Oh,
is what
okay.
a set goal for next year or something. That usually happens. But I drive, but I don't drive in UK. But I use the public transport, and my schools are like around my home. So it's either like 20-30 minutes walkable
Okay,
or like
okay.
15 minutes in bus. So yeah, but still they would bring it up. That's what I have had people who have done that community SLTA jobs and SLP jobs, and but they never, like it's a desirable criteria or a
Okay, got it.
yeah, but ultimately they would bring it up some point, and yeah, so it
Okay,
would
okay.
happen. I'm not scaring you, Meghna, but like it
No, no,
would
no.
come.
I'm absolutely aware of it. I mean, I think it also like, of course, it might be a point that's brought up as Asha says, but like I think until now, what I've understood is things are at least in that team perspective is between your line manager and you. So
And
if
you,
it's something that you guys can agree upon, be it driving or being other difficulties that you're facing as part of your role, it does play out in your favor as well at times. So it really depends because it depends on the shortage at that point in time. It depends on how many team members you have. If you have other people doing your role, then you can just stick to doing something else and things like that. So there is flexibility, and like she said, maybe it might pop up. I shall watch out for that if it ever comes. But yeah, it's been okay. It's been smooth for now. Touch wood.
So I have a
yeah, they would,
question.
and you can upfrontly tell them that no, I'm not like I cannot afford this, or I
Mm,
cannot do this because it's expensive to go for learn. I mean, driving classes, the getting a car and
mm.
insurance, so it's everything high. So there's no pressure for you to do it, but
They
at
would
some
probably
point,
bring it up.
yeah.
So I have a question. So everybody is employed via the NHS.
Yes.
So there's somebody else who who tells you to go to these schools or like these, because you Asha goes to 11 schools. Is there like a person who tells you to do that? Is like your higher up?
So like these schools are government schools are funded by council. So
Mm-hmm.
there is different clusters. So the area is divided into different clusters. So you have a caseload and you split across a region. So I
Mm-hmm.
do Stevenage schools.
Okay.
So some people do different regions or clusters they divide. So your clinical lead or uh, a manager would tell you like which area you're gonna cover up. So you would have a caseload to cover up. So we don't have a supervisor to
Mm-hmm.
report stuff.
We
You
have,
need
but I'll tell after you're done.
so like we have a clinical lead. I would have a clinical supervisor, but my clinical supervisor wouldn't tell me which schools I need to cover or
Okay,
like.
okay.
So my caseload is given to me. So I need to book in and I need to manage doing all those
So
booking
you
and
need to
seeing
schedule and all that.
everything is by
Oof,
us.
okay.
So there's
Okay.
there's no admin.
There's
But
no
compared to
admin.
my previous job,
This
I
is
never did
better.
any book.
Okay,
Like
okay.
everything was booked in by the admin. So I would come up and all my appointments are already booked in. So I don't have to
Mm-hmm.
look into any booking or anything. So it's different in different jobs. Like when I did camps with the autism thing, it was
Mm-hmm.
different. And here also it is very
Okay, so it
different. So
depends on the place. All right. So I'll just talk to Meghna and come to Swathi. Meghna, is yours also similar, like your role and your appointments, all of that?
So because it's more like community, right? So I do clinics on particular number
Mm-hmm.
of to the week, and then I do like ward, which is an community inpatient ward. So it does not have
Mm-hmm.
any acute patients, meaning there's no catheters, there's no
Okay.
lines and things like that. So more like a step down to the step down ICUs that we see in
Mm-hmm.
India, if I may say. So I do ward on one day, and then one day there is flexible working in my trust for my role, which means I do agile, so I work from home. So as part of the role, obviously there is seeing patient face to face, and then there's
Mm-hmm.
admin call as documentation.
Mm-hmm.
So my agile days basically go towards the documentation bits. I
Okay.
think that's quite similar to everybody who has flexible working options.
Mm-hmm.
And in terms of patient booking and stuff, because we have the support of admin, the
Okay.
admin
That's
take
okay.
care of that. So that's usually how it is, but it is variable between trusts. If you have a big team and admin to support, then the admin support.
Got
If
it.
not, it's your ownness to kind of make the
Okay.
bookings. And we do not have the thing of having to choose places to go to, because there are people who are referred to us from different
Okay.
areas. GP, it might be, say, a different professional. It can be somebody working as part of the larger team. So because I
Mm-hmm.
work for the Neuro Rehab Outreach team, it is basically an MDT.
Mm-hmm.
So it has psychologists, it has PTs, OTs. So one of them can refer, or it might be that patient's, say, neurosurgeon who's referring to us, or it could be anybody, which is quite similar to India again. So once the referral comes through, we kind of have something called as a triaging process, where we kind of prioritize the patients and categorize them into when they will be able to receive the care and what sort of care is more appropriate for them. Can they come into clinic? Can they be seen at home? Or are they in a nursing home or a care home? Are we supposed to be going there? So based on that, then we start booking in our appointments or just kind of get the admins to do it.
Okay. Swathi, yes.
Completely different to everybody here, which I think was quite predictable. So basically, how we work is we've got a job plan for each of the bands and each of the
Okay.
employee in that band. So my job plan, and I work 5 days full time, which is 37.5 hours a week, which comes up to 7.5 hours a day of work. It's never 7.5 hours. I will get to it. But on paper, it is 7.5 hours. So my job plan tells me I have to give my 1 day for initial assessments, which is like how Meghana was saying, triaged by someone who's above my band, because band 7s or band 8s do it. And then that automatically is booked in by the admin staff for me, because it's a very first come, first serve basis. It's the waiting list. Whoever has gotten referred at this point and have severe needs, they go onto that list, and that's automatically booked for me. The other things that I do in clinics are mainly the workshop or parent training follow-ups and reviews, and that also is a very much what time frame have they done it, and first come first serve basis. So once we've all done these workshops, we put them on the list. That's our job. And then the admin sees who needs to get those reviews or follow-ups. So that's, I would say, 50% of my organization and prioritization, and then 50% of the admin's job to get the letters in clinic room sorted. So this is my clinic days. Before, I used to do speech clinics, like I said, and we tend to see our speechy kids in blocks so that we can do that intensive therapy. The other kids that we see are more spread out. It's unlike what I worked in India. It's not 3 sessions a week or 2 sessions a week for this child. I might see this child once this month and see them once next month. Or I might say if they need something more closely so that they learn better and parents need that support, it might be I see them every consecutive week. Some I have seen once 3 months before, and I will arrange a review now. So we again are responsible based on our experience at clinic judgment to identify how many sessions do they need and how do we place that in that, and that organization's on me. So how I know which kids I take that on, that I've got our band-aid allocation manager. So she tells us these are the areas, like Asha was saying, these are the regions. And for us, Liverpool's quite a big city, so it's L1 to almost L40, let's say, the postcodes. So that's how many places there are. So I do all the south and central parts of Liverpool, which then brings me to about 20 schools that I work with and 2 separate specialist provisions. So everybody's got their own clusters, like Asha was talking about. And that my manager will give me, these are the list of children who are in these schools. And that comes to me again to prioritize and organize, because within a month I'm supposed to see these many. On my active caseload, I'm meant to have 45 children I see at schools and nurseries. This is apart from my initials or clinics and all of that. So that's a lot of organization again from my end. And when I finish the session, I have to send a task to the admin to say, this is the next date I want you to book them on. The letter bits are sent out by them. The reports that I type are sent out by them. But the scheduling bit, the organizing bit, all of that's on me. And then because I don't have a car and I do public transport, my department, like Meghana was saying, we've talked it out. We've worked with my supervisor to see what are the best bus routes, and they've tried to give me as much as possible the bus routes, but it's unlike our we take it for granted, I swear, in India, that we've got lovely public transport, because if I miss, or if the first bus is late, the next one is missed, and then I end up walking at least 30 minutes to the appointment and I'm still late. And this is with our therapy toy bags, assessment bag, our laptop bag. It's not like, oh, we've got a center that they're coming to, so I don't have to carry anything.
You don't have Ola Uber as easily as you do here, I guess.
We
Yeah.
do have Ola Ubers, but it's quite
Super
expensive because of the labor bits.
And
Anything
you
that's
can reimburse your money when you do a community job. So
but not the Ubers.
Uber and
Only public
okay.
transport.
yeah, So only bus fares and
Oh
tram
no.
fares
Okay, got it.
would be reimbursed when you put the expenses at the end of the month.
And
So
then this again depends on what part of UK you're in. So London is probably super, super well connected by public transport. And it's almost
Okay,
like Bangalore. It's better to take the metros than take your
correct.
own vehicle. But something like, I don't know, when Asha was in Darlington to get to her place in Middlesbrough, she had one in 40 minutes, I think. And with the rain, snow, that can be late, that cannot show up. If there's too many people in the bus because you can't stand in the bus, the driver might not stop. All of
Oh,
these things. Oh,
Yeah,
yeah.
you
no
cannot get into the
overcrowded
bus.
buses.
No, like
All
nobody is
sorts of
standing in the
things.
bus, and
Bus.
so you
oh,
cannot get inside the bus at all.
it's
They will
such
like
a change from
eventually
India.
Oh, yes.
People are
you won't
hanging
get in
out of the
there.
buses in India.
No
Exactly. No.
chance.
And
Oh,
so all of these bits add into that mix. But
okay.
then you get a rhythm, you get a sense of it. If
Mm,
you're in cities like Manchester, you have more than one means, like trams and
mm.
buses. Liverpool has local trains and buses and ferries, but I've never had to, thank God, go to a school on a ferry. But again, it depends on if you're more in the urban side, you've got better public transport. If you're
Mm.
more in the
Are
rural
all of
regions,
you in
that's
the
not the
urban side?
greatest.
Um,
Are,
I
no.
am.
I'm not.
Okay.
But
Yeah.
I would say the city seems to be quite well
Okay.
connected. So there are buses every 25 minutes, then there are buses every 40 minutes, and some run hourly. And here, just like Swati mentioned, because even though it's well connected, there are good days and bad days. And in those cases, when you take, say, even cabs for your visits, thankfully, my trust seems to be
Oh.
reimbursing it.
I got a reimbursement when I don't know if you recently saw that we had this whole riot, which was unfortunate, but it was quite difficult for
Yeah.
people to leave their houses. So that's the only time
Yeah,
I've
at that
gotten
point, I think they did give
taxi
it.
reimbursements, and they made sure I took taxis. And this is how understanding they are. They will try their best if you try and
Okay.
voice out. So they're there to help you out, but the situation's just different.
Okay.
In
Okay.
terms of what I do with the school, I work with children who are 0 to 18 years old, so it differs what I'm
Mm-hmm.
seeing, my caseload. If they have what Asha was saying, the education healthcare plan, it can go up to 25 that we're seeing them. So some of my schools are primary, and some of them are secondary, and some of them are what they call colleges here. So going to different bits. It's mostly my caseload, I want to say, has been autistics with GLPs,
Okay.
ADHDs, um, very few DLDs. I've very happily stayed away from all the phonology and Arctic, but that was part
Articulation.
of my caseload then.
Okay.
We don't do stammering because there's a separate care pathway, and that's how it
Oh,
works.
okay.
Everything is a separate pathway, and
Mm-hmm.
everything's a different um, protocol because they're all commissioned and funded differently. And
Okay.
that's
Okay. Got
something I
it.
do kind of miss from India. It feels a lot more streamlined, which is probably nice, but I feel like it takes away the holistic skill set that we do from India. So if there's a stammering kid that I see, I have to refer them onto the pathway. If
Okay.
there's a cleft kid, I have to refer them onto the acute team. If there's someone who needs a diagnosis of autism, I need to refer them onto the autism pathway. Anybody who's finished their stay at the hospital comes onto our community team, and based on the region, we get assigned. The specialist schools are the ones we've got our cerebral palsies, our AACs, and that's brilliant, and I do that as well.
Mm-hmm.
Yeah, workshops, parent trainings,
Okay.
meetings, hundreds of staff meetings, networks, and that's really nice.
Okay.
All of these bits just in the mix, yeah. And
Okay.
students on placement. So again, I think that's quite different to what we've done in India, because I think we've taken for granted we study in institutes that give us the exposure right there. So students here have to go to different hospitals like us or different trusts and work with us to learn,
Mm-hmm.
which I think is a really nice way to see what happens in the real world. But I also feel sometimes it also depends on the quality of placement, how
Which
much
they
they
get.
are
Yeah.
interested to learn. It's all very subjective. So again, pros and cons for both. So I do that. We do
Okay.
have health visitors come in, or other professionals who want to shadow and learn so that they can make the right referrals.
Mm-hmm.
So we've got that. Every child that I work with has at least 5 different points of context that I need to be in, which is the school class teacher, the what we call as a coordinator for special education needs, the SENCO. Then we have parents. The dynamics of families are quite different here than what we have back home. So way going around that, navigating that, that's quite challenging as well. And then if they're, let's say, if they're known to Meghana as well, then I have to make sure that it goes to Meghana, the pediatrician. One thing I
Okay.
think that's quite challenging, and I think everybody else would agree to this, child safety is the highest priority here.
Mhm.
So there's a lot of documentation.
Mm.
I have never, and that's what I was saying, I've never finished in 7.5 hours. My transport alone takes 1.5 hours each, or at least one
Mm.
side, and that takes a lot of time off me. And if I don't, nobody asks me to put it back, but if I don't put it back, then I have a lot of pending work.
Correct.
And we are meant to have the notes uploaded and documents ready within 24 hours. That's the HCPC guidelines.
Whoa, okay.
And it's quite accountable and very transparent. So if a parent asks for it and I don't have it, we get the audit from HCPC, which can cancel our license.
Mm.
So there's a lot of pressure. There's a lot of what we call safeguarding, meaning if the child's in any sort of distress, emotional, physical, mental, from the family, we have to report it and escalate it. And that involves social work, which then makes it a bit more complex, social worker and care systems. Yeah, quite a lot of dynamics to work around.
If
But I
I'm
wouldn't trade
if
it
I just
for working with adults.
yeah, it's quite similar in terms of adults as well. There's safeguarding
Yeah.
for adults. There's a
I
social
know for a
worker
fact
involved.
the documentation's less because I have a student who's working with me. She's come off her adult placement. She's like, I am never coming to pediatrics just
Yeah.
because of the amount of reports we have to do.
The
No,
one
I
good
think
thing
in
I like
terms of
about
adults, it's
is the
more about
documentation.
trying to get the notes in, like she said. And of course, we do also have to do letters, but I mean, not that
We
many.
have
So
the
now,
notes, we have the target sheet, we have the outcome measure sheet, we have the discharge sheet, we have to write a letter to the school, we have the EHCP, and God forbid someone goes to the court, we have to make one for the tribunal. This is basically for all children we see. Forget the exclusions of, oh, they need a hearing aid, can you make a referral? Oh, they need this, can you make a referral? These are like not even the referral sheets, these are basic documentation each child requires.
I think now we are scaring people from coming to the
Sorry,
UK.
no,
yeah.
like I said, I wouldn't trade
The
this. I wouldn't
reality.
trade this to go to adults. So that's how much I'm saying I love it.
Reality.
Yeah,
That's
reality is
the
also important, right? So
Yeah.
because
Don't
people
mean to
shouldn't come
scare
in thinking
anybody.
it's all happy. So I want my other question was that it's never a 9 to 5 job. You all said that, but do you actually put in a lot of work even after your work hours?
I have done that before, but now I've like
Yeah.
kind of like very much because I've gone across, I mean, different places.
Mm-hmm.
I've been strict with, or like I'm done. That's it. So I don't like I kind of stick to my half.
Mm-hmm.
So you don't have to pick 9 to 5. You can pick anything. So
Mm-hmm.
I've done different time schedules. I've done weekly 4 days. I've done long hours. I've done short days. I've done 3 office days, 2 work
Okay.
from home days. So I've done different like schedules because the jobs are very flexible, depends
Okay,
upon
yeah.
like, on the trust and what job you're doing. So I kind of stick to 8, half 8 to half 4. At
Mm-hmm.
times I pick like 8 to 4 and stop my work by 4. So
Okay.
yeah.
So for me, it's basically, I wouldn't talk for the pediatric speech therapists. I know the documentation itself takes a lot of time, and like I'm no one to comment about it. But especially for me within my hospital when I started, like I do 9 to 5 now, but I used to stay till 6:30. I'll be there in the hospital, so there will be too much work. But then there you come to a point of time, then we say no more doing more hours because initially like some trust if you put in that extra hours and if you show a clinical need for that they might pay you extra or for those
Okay.
hours that you do, or you can take that time back and like, maybe you can go home early another day and all those
Mm-hmm.
things. But then at the end it's just like that work life balance might get
Yeah.
affected if you do that for a long time. No one asks us to do and no one expect us to work like
Mm-hmm.
outside of working hours, and if we still have work to do and if we didn't complete no one will judge us.
Mm-hmm.
That's one good thing I've felt about my
Mm-hmm.
workplace in general. So now I have stopped doing that and I try to do only what I can do in
Mm-hmm.
a day and I always keep it to the next day. And if someone questions like why you didn't finish, like we just need to show the clinic like this was my day, I was fully packed with meetings, seeing patients. So if you always give a logical reasoning to it, it's fine. So I've just stopped taking that extra hours. But if you start doing them, there'll be enough to do for almost, you can stay back 24 hours in the hospital and your work will not finish. But yeah, there's quite, because
Okay.
we are short staffed and we don't have enough speech therapists to support the kind of caseload we have, you can easily stay for longer hours in the hospital. You'll always find the job extra.
Okay.
Yeah.
Okay.
Yeah, I think I agree with that as well. There is enough work all the time, or something. What we call as the admin is always going to be there. Some letter might be pending, some referral might be pending. It's going to be there, irrespective of adult or pediatrics. Definitely on the higher side for pediatrics, from what I've understood now. But I think end of the day, one thing that my trust and team have been really supportive of is like, if you are having to do that on a consistent basis, though you're advised not to do, because they do respect your work-life balance here very massively. That is one thing that I found like very nice when compared to India. So in terms of that, they do come back to you, and if they do see that you're consistently working extra or you're having to come in early or things like that, they will kind of themselves propose an alternative plan, like you can do these many days so that you receive that amount of
Okay.
so that does happen. Maybe even this varies across trust, but I suppose most of the trusts do try and make sure that the employees work only 37.5
Okay.
per week.
I think I agree with everybody. So when I first started, and I am like this as a person as well, Asha knows me. We all want to do the best, and it is quite hard because in my trust, I don't know about others, I'm the only international recruit, and it's almost like an extra added pressure. You don't know if others are going through the same thing, so you think, oh, it's probably just me, I'm not able to do it, or I'm new to the system. So initially, I took a lot on and wouldn't talk to anybody about it, thinking I just need to buck up or I need to do this. But later, when I started making friendships and relationships, started realizing everybody was feeling the same way. But there have been some who've been able to manage to do it, and we looked at why can they do it as a department, and that's probably also coming from the kinds of caseload we would see. So something maybe which is like a speech clinic is quite easy and gets done then and there, but something maybe with an ASC or swallowing, and that might take a lot more time because you have to reach out to 500 different professionals and do things. So after a while now, I still do work, and I was just doing one before this meeting, which is not great. But I have managed to sit and talk to my supervisor, and we've come up with a plan, like Meghana was saying. And these are called reasonable adjustments, basically looking at what kind of reasonable adjustments can we put in place till I figure out a system. It's not to say this is my forever plan, this is we'll exclude you from doing this, or we'll exempt you from this bit. No, you are struggling at this point to get this sorted, which is part of your role. How can we help you support get there? And there's a very and I think this is one of the brilliant things about the UK system. There's a no blame culture, like how Athira was saying, nobody judges and, oh, because you've not done this, you are causing this. There's never a blame. They always try and sit and figure out what's the best way to approach this now. It's not to say it's taken casually, because if things don't work out, let's say you've not added your notes and it's come to the manager's attention, an incident can get filed against you, which is not the greatest thing. You don't want to have it. But first, before they jump into all of that, they will try and figure out with you, why is this happening and how we can sort it out. I have after this become much better, and it's probably also a very personal learning that I need to do, which is organization. And we're not used to these kinds of tasks before, so probably it's quite challenging to learn that. However, I do know a lot of other therapists in my department are still struggling with it. So it's probably a general understaffed, lot of pressure and it's just thing as well.
Okay. All right. So I think we're almost at the end of the questions. I want to discuss about the salary. Is there like a median salary for SLPs depending on your bands? Is it available on the NHS website or somewhere else?
Yeah, it's usually available online. So basically, if you just look out, just type in the salary bands for, like, as we mentioned earlier, like for band 5, band 6, band 7, the salary range is different. So, and it also differs if you are in London, in the London area, the salary is
Correct.
higher when compared to outer London areas. And for band 5, it can be around 29,000 to 35, that range. And when you start, there's actually a so for band 5 there's a range of salary, and within that there will be 3 points. So when you start first, you will be in the first point of the salary. So say if it's 29 to 35, you will
You'll
receive
get 29.
29,000 per year. After 2 years you go to the mid band, and after 5 years you go to the highest band of the salary. But
Okay.
it's usually online, so anyone can actually find it out
Okay.
from.
However, I've just from one of my friends realized you don't have to agree to your first step. You
Yes, yeah.
can, with your HR,
Negotiate.
take it up. If you believe you've got the skills and experience for that role and you think that's quite a less salary, you can negotiate to go on to the whatever, the intermediate or the top step.
Yes.
I've never had the courage to do it.
I think, yeah, that's one thing we didn't like. Personally, I didn't know that was a choice. And being an international applicant and everything, like coming from India and everything, like we don't usually ask. Like sometimes you don't have the
Yeah.
courage to go and ask. So we just get satisfied with
Right,
whatever
okay,
we get.
yeah.
But yes, that's always an option.
It's like always
Yes,
you need to ask for it. If you ask for it, you get it. If you don't,
get it.
You
Yeah.
might get it.
You
No
might,
one will
yeah.
mention
it's
that.
not like always you get it, but still, like
At
if
least
you
you
ask,
asked, so yeah.
you can negotiate,
Yes,
or
Correct,
you
correct.
can ask. There's no point in like there's no judging, or like how can you even ask like that? There's nothing like that.
no.
But again,
Correct.
this wouldn't be something you discuss in your interview with your line manager because everything's really streamlined. It's not within their remit, so they have no clue about recruitment. So it would go back to your HR or your
HR,
recruitment team that you
okay.
discuss this with. Even if you say something about this, your line manager is going to go, well, I'm not sure. Sorry, can you please
Okay.
go back or I can check back. So it's something you would do after your interviews, I
Okay.
think, to
Yes.
negotiate.
You
But
were
it
also
won't be the line manager, it'll be the recruitment.
so you were also talking about how it's different in different cities. Is it because the cost of living is more expensive in London compared to the other
Yes.
places? Yeah, okay.
Yes.
And even probably like right now, Swati is in an urban place, Meghna is in a rural place. The cost of living would vary there.
It will, but the salary does
Salaries
only London
wouldn't.
gets
Oh,
That's the
London
same.
pay.
And
okay.
to be fair, I think what we can kind of draw comparisons to is London and other places at the minute, because everywhere it seems like the cost of living is the same. It
Yes.
really does not make a
It's
difference in terms of
increasing.
if you're
Yeah.
saving in one place, let's say you're saving in your rent and groceries, then you're giving to public transport. If you're saving in public transport, it goes elsewhere. So
But I think it's
Yes.
quite
like
different because South generally is a lot more expensive than the
Expensive.
North.
Okay.
However, South has the most facilities because most of the funds, the UK government funds, goes to South
Okay.
and not North. So more facilities, more money, less facilities, lesser money. And it also kind of depends. Let's say you've got family, you have your own car, you have everything set up, then you're probably not spending differently, isn't it? But consensus would be South is more expensive than North, but South has a lot more facilities than North.
Okay. The other question which I want to talk about is visa. So you were talking about how the sponsorship happens through the work, right? So the job provides you with a sponsorship. Does it come with like only 2 years, 5 years, anything like that, or as long as you work with them?
No. So basically, for me, it was like when you get the job, they would say if they're going to sponsor us or not. So if they're going to sponsor once we get the appointment letter and everything is in place, so the HR would get in contact and give us a certificate of sponsorship.
Okay.
So and there will be a license number, like an certificate of sponsorship number in that. So with that
Okay.
we can apply for the visa, and it depends. Like sometimes they would give for 3 years, and after 3 years the trust would give you an additional 2 years in some
Okay.
cases, and in some trust would give you the 5 years
Okay.
like beforehand. So for me, I got 5 years sponsorship visa, and after 5 years we can apply for ILR. So I think most of the trusts would only sponsor you for the maximum of up to 5 years,
Because
because
then
after
you're
that we have
eligible for the
ILR.
ILR, which is the indefinite leave to remain, PR
Okay. Like
equivalent.
equivalent. All right. Got it.
Yeah.
Okay.
Yeah, depends on the trust if they want to sponsor for 3 years, 5 years. Initially they were all 5 years. Then I think it was cheaper for them to do 3 and see.
Then extend. Okay.
Yeah, some of them have declared bankruptcy and then people have not had renewals. Some of them might not have lived up to their expectations and don't get renewals, but most of them do
Okay.
get their extensions of it.
Okay. All right. So
But for private, there's a board because I know, like I said, I wouldn't know who and how, but there's an what we call as an Association of Speech and Language Therapists in
Mhm.
Practice, ASLTIP. So it lists all the private practices in the
Mhm.
UK because they have to be registered with that to have a
Mhm.
private setup. So I think if people want to look into private, they can go on to their websites from there and see if they offer a COS. I
Okay. All
know
right.
one of Asha's and my friends wanted to look for it, but I don't know if they were giving a certificate of sponsorship. No.
No. Okay.
Yeah.
Yeah.
Okay. All right. So I'll just quickly do the one or two questions about masters because Athira has done her masters in the UK. So you were telling me it's a 1-year program, not a 2-year program?
Yeah. Yes. So in UK, like there is the 2 years master's course, which we like similar to what we do in India. But
Mhm.
the main thing was the fees. Like the fees is really high.
Mhm.
So for 1 year, it could be up to 17 lakhs or something. So when you do it for two
Okay.
years, it's multiplied by two. So there is that fees, or that fees is always a concern. Apart from
Mhm.
that, what I personally felt, it might be different for different people, but what I felt is that here, like if you are an OT or if you're a psychologist and you have your bachelor's in psychology or OT, and you feel like, oh, like speech and language therapy interests me, I want to change my career into that, you can
You
take an MSc
can.
speech language therapy
Yeah.
and you can become a speech therapist and work like that.
Okay.
So
Okay.
for me, basically, I thought like I have done my bachelor's, and when I compared the syllabus with the MSc program that they give here, yes, it is a bit more advanced, but most of the topics were like the
Similar.
same things that like what was in the syllabus for a bachelor's. And when I contacted one of the university, they did ask me, "You already did a like course in speech therapy. Why
Please.
would you
Why
want
do
to do the
you?
same thing?" I told it's master, so I want to improve my knowledge and gain more
Mhm.
insight. So sometimes I don't know, I felt like sometimes it's more for people who wanted to change their career or like to do more
Okay.
in-depth
Okay.
knowledge. I might be completely wrong about this, but this is what I felt
Okay.
like.
Okay.
So what I went for, sorry,
No,
someone
go on.
wanted to say? Oh,
No,
yes,
no,
sir.
go on.
Yeah, so what the master's course, what I did was MSc Language Sciences from
Mhm.
University
Mhm.
of Reading. That was basically like it would say like a specialization course. So it looks more into the research aspects of like if you want to move into a research related course, if you
Okay.
want to
Got
do a
it.
PhD. So it's a bit more specialization
Okay.
masters, and it wouldn't have the clinical aspects of it. You won't be seeing patients and you won't be
Oh.
doing
Okay.
that
Okay.
bit, but still
Okay.
but then like still you have a lot of modules you can select from. So you will learn more about autism, multilingualism, neuroscience of language, then there'll be linguistics. So there's quite a wide variety of modules you can choose from. So I chose, like I was mostly I was interested only in adult working
Mhm.
with adult population. So I chose neuroscience of language, multilingualism, and a few related
Mhm.
topics.
Mhm.
So within 1 year, you have to do a placement, but that would be a research placement
Mhm. So you
where
didn't
I will
opt
be
for that.
assisting one of the professors doing a research.
Okay. Okay. Okay.
Sorry? Yeah, so I
Yes.
have to do that, the placement and a dissertation. So it was
Okay.
mostly research based, and
Okay.
on top of the research knowledge, you will also get to know the recent recent updates in our field, the
Okay.
recent studies
Okay.
that has come out. So it gives like more in-depth knowledge. So that's
Okay.
the course which I went for.
Okay. Would you maybe, I don't know, like based on that you have done it, would you suggest SLPs from India to do it if it's easier to
Yeah.
get, it's
Yes.
interesting?
Yes, and I think from in my university there were like few of the lecturers were from India as well, so it was
Mm.
really nice to have that connection. And I was able to build a good connection with a lot of lecturers there, which really helped me with
Mhm.
my letter of recommendation for my job role. So
Mm.
I had a good networking from the university, and the course itself was really nice.
Okay.
It is worth
Worth it. All right.
if you're,
Okay. So if
but there are a lot of other courses across UK.
is it related to speech and language pathology only?
Yes, yes.
Okay.
As I said, you can always take the 2 years MSc. I've seen, like I know speech therapists who have done that, and it's
Mm.
really worth. Like for me, that financial aspect was
Correct,
always
correct,
a
correct.
hurdle. So like I couldn't really go for the 2 years
Okay.
masters. So, but there are like few colleagues of mine, a few friends of mine whom I know who have taken the 2 years masters also.
Okay.
But and apart from that, there is this 1 year, a lot of 1 year masters courses
Diploma.
also across the UK.
Manasa, if I might just add a bit more. So I might be outdated because my information is from 2018 when I was looking into doing masters in the UK. So at that point, what I came across where there were obviously 2 year courses and 1 year masters. And 1 year masters included other options like you can do specialized masters in just acquired communication disorders or just childhood language disorders and things like that. And that was again open to anybody who wanted to take up such a course from any background that was related to science and things like that. And there was something in terms of the 2 year degrees. What I came across was something called as a pre-registration degrees, which was listed on some of the universities, and some just called it in a different name. But those were again from my research into how these syllabus was laid out for these courses. What I came across was these pre-registration courses kind of had whatever we studied in our UG for the masters, just like how Athira mentioned. So one a bit of advice might be that just have a detailed look at the syllabus when they're looking at the university websites, because they do list them, most of them do. Or it might even be worth just emailing the universities or finding people on LinkedIn as well, because this is what I did. Professors who work in that university and leaving an email, just have a chat about how the course is, because they will definitely be able to tell you. I did have somebody from University of Reading, which I got into, telling me like, what we can offer you is basically a neuro lab that we have here, which is really brilliant. But then I did not go ahead with it due to some reasons of mine. So you can have a chat. Feel free to just email somebody
and talk to them.
Just do your research a bit more into what you need for your masters. So it is definitely worth it. I think from what I'm seeing here in terms of doing it here, but it might be what you want or might also not be what you want.
Correct.
Because at this point, I know even India has masters in terms of specializations as well. So definitely we're coming up with that. So if that is what you're more keen on, so you might be able to differentiate a bit better. So research is the key, is what I think.
Just to also add on, I know we've got apprenticeship programs. So while you're working, you can go to your university and get your degree. So in that way, you're making some income and money as well, and you can study. You'll have to find out, obviously, if your employer is happy for you to take the apprenticeship and all of it. I also know we do something about which is called clinical. Frankly, for me, again, I've been super privileged to have had my foundations from India. I'm in fact the go-to person with my supervisor sometimes to come back to what would you do in this situation. So I feel like as Indians, we've got lovely experience and knowledge, but it might be worth looking into that as well, because it might not just then be a clinical role, because here moving into higher positions means it comes with a lot of other things: leadership, research, coordination, equality, diversity, inclusion measures, all of these. And maybe those courses like the clinical practitioner courses might offer things like that. But of course, I don't know anything about the master's program because I've not done it.
And I don't think all speech and language therapists who are working in the UK, like who are UK citizens, have a UG in speech and language. They're either from a psychology background or a different background and do a master's. So I genuinely go agree with what Swathi said. Like the theoretical knowledge, what we have
It's a lot
is
more.
really high and much better. And if you ask a question to them, they might like, this is not my area of specialization. I don't know. And I'm like, yeah.
I have seen like in one of the hospitals, like if a patient, if a staff is working on a stroke unit, and if a patient with Parkinson's diagnosis comes, they'll say, oh, that's not my area of specialization. So there's a different set of team for Parkinson's patient. Or when we get a voice patient, so I had one patient in my hospital who had a voice issue. So I pitched in and I told I can help him, because in India we used to deal with all the patients, but then they said no, like you're not covered to do it. Like if a patient has a voice issue, he or she should be sent to a voice clinic, and they are the specialized people to do it. So there's a lot of things like that.
It's
So having
also understanding. It's not to say that they don't know SIP. They probably might not. That's a whole other thing. But there's a lot of, like I was talking about, care packages and this commissioning. It's everything
yes,
comes down to, is this within the remit of my role? And right
Okay.
from their placements, they are very streamlined to, I'm going to work with children but fluency. I'm going to look into my placements with adults Parkinson's. So it's very streamlined right from their placements, which makes them. So when I came in as well, it was quite a challenge for my employers to categorize me, and now I'm a generalist because I work with everybody. But they are also trying to look at what are you really good at and what value will you bring. They're happy to have a generalist, they're happy to have a holistic approach person, but they also want to say, how can I see what are
What
you an
fits?
expert
Okay.
in, because that's how they look at it. So it's not to necessarily say they don't know, they might or might not, but it's almost like a, this is not within my remit and I'm not meant to cross those lines. It's very, those professional boundaries and what's our role and what's not our role. Like when I talk about AAC, I now stop myself from giving advice about literacy, because as a speech and language therapist in the UK, we're not supposed to talk about literacy. It's only an education psychologist who can do it. When I'm talking about autism, we always did have to go back to occupation therapist, but we could say, oh, we can look into breaks now. I can't say that now. I'll say, okay, we'll give a break, but can you please go back to the service and ask them what kinds of breaks I have to give? So it's a lot more yeah, like I said, it's kind of bittersweet. I do miss the being holistic person, but it's also very much looking into what is within my remit and what am I going to bring to the table for this person or for this department. Yeah.
yes.
Okay. All right. So I think we've covered a lot of the questions. So my last one or two questions is so you mentioned that there is a group or like an I don't know, Isha kind of thing for SLPs. So are there conferences which happens for SLPs? Have you guys attended any of it?
Yes,
Okay.
to be honest, like so we talked about RCSLT, which is the
Yeah,
Royal
correct,
College of Speech
correct.
and Language Therapists. So when you become a member of RCSLT, so there is something called as Clinical Excellence Networks, called as SENS. So if like there is different clinical networks for different population. Again, like you have SEN for aphasia, you have SEN for mental health, you have SEN for
Okay,
autism, SEN
okay,
for dysphagia. So you can join as many SENs as you want. You
okay.
just have to email them telling that I would like to be a member of your SEN. So, and if they accept us, which they always do, and if they have a study day or any webinars that they are doing, they will send
Send
emails
you
to us
all
where we
right.
can take in. Sometimes it would be a paid one, sometimes it would be free.
Okay.
So for me, basically, since my role is majorly in dysphagia, within UK, if you're going into dysphagia, you have to do a separate course. Like even if you're a qualified speech therapist, when you're going into a specialization dysphagia thing, you have to do a short dysphagia course. So there are few places which gives that which basically helps you sign your dysphagia competencies. So I had to go and do an extra course in University of Leicester.
Okay.
So it's basically a post graduation dysphagia. It is called different in different
Okay,
universities. There
okay,
is one which is provided by Manchester, one by Leicester, one by Sheffield University. So you just have to get it to
okay,
sign your competencies and make sure that you are clinically competent to deal with patients with
okay,
dysphagia.
okay,
So I had
okay,
to go through that, and my organization funded me for that.
okay,
And when it comes to this RCSLT sense, they have this study day. They block a whole day, and you can do like a dementia workshops. There is workshops on video fluoroscopy, fees, everything. So I have attended few webinars of such sort.
okay, okay,
Yeah.
okay.
The RCSLT also has a yearly conference, like how we basically have with our Isha. And again, so like how Athira was saying, I think it also depends again on your trust and how many people are there. So we're about 40 speech and language therapists in our department. So if more than one person asks for the same course, they're going to look at why we're asking for it, and
Yes.
we have what we call as professional, basically like an appraisal, and you need to have put it on your yearly goals, like, oh, I need to get myself competent in dysphagia. If I have it and let's say Athira didn't have it, I would get preference to go on to that course. Otherwise, depending on what the team leader or the line manager thinks this person's the best to go on to this, so they can bring back these learnings for the department and change services. So it depends on how many people are aiming for the same post, basically, or same learning. In terms of those study leaves, as Athira was saying as well, it changes according to different bands. So each trust again, so you will have a set number of study leave days that you can take to attend any of these ones. If it's free and if it's on your own time, nobody bothers. They're like, yes, happy for you to go for it.
Okay. Okay. Um, okay. All right. So the last question, I think two questions, sorry. So what's something you love about the UK?
Oh,
Living
give me,
there,
I
working there, anything.
think,
Oh,
like,
to me, it is definitely the work-life balance. Sorry, Athira, I
yeah.
just jumped the gun.
No, no,
To me, it's definitely the work-life balance I've got here. I mean, of course, in terms of the network and my friends or whoever, the community, I definitely miss because I've left it all back home. But it did take some time for me to kind of build it here. And now that I have it, it's like there's enough time to kind of give an importance towards what life actually is. Do things on in your own time and pace, because that was never an option back home. Yeah.
I think it makes you more independent when you come to a different place, especially within UK. Like it makes you super independent, like managing your work, which like for me, like I have not done it. Like back in India, I always had that support. Like if I come back from work, I didn't have to cook for myself or I didn't have to do any of the work. But here it's just that finding that balance, and it has made me a lot more independent when compared to when I was in India. And the work-life balance, that's like the real catch in UK. Like no one expects us to do more than like you really need to do in that
Correct.
7.5 hours. And then you have good annual leave packages, like, and they ask you to take it. Like even if you say, oh no, I don't want it, they're like, you need to take it. So they prioritize your mental health and your well-being here, which is quite different from few settings back in India, which I guess. And then you have sickness leave, everything is covered by a job role. Then one thing I've liked about the job in UK is you will always have a supervisor for you to guide you, and if there's any concerns, we can go back to them. I have like monthly meetings with my supervisor, which was really helpful for me.
Okay.
And then there is peer supervision groups where I go to two peer supervision groups. So one is within the multidisciplinary team. So the band 6 OTs or band 6 physio. So we all come together and we meet monthly to discuss how we are doing, what are the challenges we are facing. So we always have that peer support. And I also go for a group with other speech therapists. So it's always nice. It's like we have all the support what we need, and it's good in networking and everything.
Okay.
So I found that really good about the work culture in UK.
Okay.
I think I was about to say very similarly, Athira, that there's help if you reach out. Nobody is
Yeah.
going to read your mind and think, oh, this is what I need to support you with. But the moment you ask it, it can come through either a colleague, it can be all of your colleagues, it can be your team lead, it can be your line manager. They're all there trying to help and work out. The amount of importance mental well-being is given. I think that was something that I missed back home, which is yes, I understand it, and I think this is a quick fix, but it's never a quick fix, especially with mental well-being. So I feel like that here is very different, and the fact that there's no I'm superior than you or you're inferior to me. And it's not just within the department, it is through all professionals, all different walks of life. Everybody is treated with respect. They mean it or not, that's a whole other thing, but at least nobody comes out to you and says something bad or makes you or treats you with disrespect. I've only felt love. I know people who've had different experiences, so this is not to invalidate their experiences, but I've only had love and help and support. So I think that's brilliant about UK for me.
I think for me, it's the work-life balance and the flexibility. Like, if you want to do a work from home, do a day you can pick what you want to do. It's like 8 to 5. It's like you need to do 7.5 hours. You can split it.
However it is.
Not
Okay.
all yeah, however it is, you can. And if you want to early start it and early end it, that's fine. And it's like, I don't think all the jobs are flexible enough, but like they do have a flexible options in most of the jobs. And if you tell, they would do reasonable adjustments and help you to, what accommodate what works best for you. So
Okay. Okay, makes
And I
sense.
think another thing is also there's enough openness to learning, like just like how Swathi mentioned, the concept of not having any seniority or this juniority in their head, it just provides a lot of platform for learning and trying to share what they know. And I think end of the day, everybody's goal is to just make your life easy and
Correct.
keep themselves also kind of at ease. So it's worked out pretty well.
Okay. The last question, any advice for aspiring SLPs who want to come to the UK? Just anything out of your experience or anything you just want to sum up about what we spoke about. Just let's start with Athira.
Oh, like I personally think like if someone from from India now, like if they want to come to UK, so if you don't really want to do a master's, then you don't have to come here and do a master's. You can directly apply for a job, because in UK you have the provision for that. Like you don't have to feel that, oh, I need to do a master's in UK in order to get a job. So don't do a master's unless like you feel okay, you really want to do it, or if you're financially sound well, like it's your choice, you can do the masters. Otherwise also don't feel pressurized to do a master's here in order to work. And the other thing I would say is like, when you come here, do not doubt yourself. Do not think that, oh, I'm qualified from India and like it's a new country. Like do not doubt yourself or anything. Like just go for it. Do not hold yourself back thinking that it's a new place and like what if I do wrong. Like there's always room for mistake. Like if you do a mistake, you can learn from it, and just be open to learn new. Like when you come here, you need to adapt to the culture here, and you need to adapt to the working condition here. So few things we will have to leave back in India, what we learn from India, but then few things you should be open to learn how things work here. So that's something that I would like to
That's
advise
nice.
anyone who wants to come here.
That's
Yeah.
nice. Okay. Meghna?
I think Athira did cover most of
Most
it.
of it.
Yeah, there's a lot of unlearning that you'll have to do, just as she rightly pointed out too, and a lot of things that's gonna probably be overwhelming as soon as you land here. Just take it easy on yourself, be slow, and voice out at any point to whoever is available around you, and I'm sure they will help you out. Maybe not at the first go, but somebody will be able to help you out. And maybe as soon as you start the process, I'd say get into research about what HCPC is and what they really require. And, because like we all highlighted that's the main requirement to get here as the first step. Everything straightforward. Again, that might be overwhelming too, but it is just there. So it's the easiest way to start your process. So take it like maybe in baby steps and you'll get here. So
Yeah. Swathi?
I think I second both Athira and Megan. I was just thinking if I said don't be me, is that good advice? Anyway, learn to ask for help. Get help because there is help everywhere. I feel like that was one of the biggest things that I had to learn, which is it's okay because
Unlearn
I
from
think
India and learn, I think.
yeah,
Yeah.
because we bring the most unique perspectives
Yeah.
because we've seen different ways of working and we've got all the skills and knowledge we need. It's just figuring out a system or skill sets that we haven't had the chance to learn or practice. And it takes time. It takes time for everyone. I feel we're so independent because we think, oh, we've also worked independently, probably, like even
Correct,
within our
correct.
clinics or studies, even though we were put together, we never had to sit together or do things together, work together. So we all tend to figure things out for ourselves. We don't have to do that here. So learn to ask for help and it's okay to take help. And this, I think, weather-wise, someone said to me, there's no bad British weather, it's only bad clothing. So as soon as you get here, get yourself a good pair of coat, jacket and boots and you're sorted. Umbrellas don't work, at least not in Liverpool. I think
Okay.
food and everything everybody can manage. There's an
Okay.
Indian store, takeaway, every other
Everything is there.
street.
Yeah.
So I mean, you'll miss your home,
Yeah.
friends, community, all of that, but you can manage to find it.
Okay, Asha, any advice?
It's the same, and I think uni, there's a lot of learning and unlearning compared to like protocol or test materials. Everything is different. Even you have 10 years experience, you might to come down here and do a lot of different stuff from the scratch. Yes, and it's not the posh life you see. It's very different, and like it's
Yes.
not,
Yeah.
it's very different. Be it student, be it working professional, it's different. And Athira already mentioned, like, unless you want to do a master, it's the easiest ways to do a study, move, easiest way to move abroad to pick a course. Half of the people do that, I think. Like, oh, okay, fine. I just want, maybe most people want to do, like, if you have a particular interest in specialization, it makes sense, or else it's just like you're making things harder for yourself.
Harder.
Because I've seen, like, my friend, even Swathi knows, it was a struggle for like people who have chosen to move, and it is difficult and it's very different. So
Yes.
But I just want to remind, like how Meghana was saying, it takes time, but you find your community, you find your feet here, and then there are wonderful
Yes.
moments. So if that's something people are considering, it is definitely there. It's just not easy, but there's help,
Yeah.
and everybody's here to support that. It will get better.
Okay, that's nice. So I think a lot of inspiring words and motivating also for a few people, because a lot of people have been asking, and everybody's obviously worried about moving to a new country and a new place with nobody you know. But like you said, help is always there if you ask for it, and if it takes time, but then you find a community, you find a bunch of people who you can rely on, and it'll get better. So that's nice. And thank you so much, everybody, for talking about all of this. I think we've almost been here for 2.5 hours. I thought it would just get over in
You
one
should
and a
be
half hours.
sleeping by now. Sorry, we've kept you up for so
No,
long.
that's okay. Thank you for spending your Sunday with me, because I know this like takes a big chunk of your day. And thank you for being so open about everything. I'm sure this is going to be really helpful for other SLPs who want to apply. And even if people ask you or don't have a lot of questions, you can always refer them to this video. It'll make it easier for you as well, I think. Okay.
Thank you
Thank
for
you so
organizing
much.
this. Yeah.
Yes, definitely.
Thank you
Thank
for
you so much
having
for
us. It
having us.
really is
As
helpful.
always, you do a commendable job, Manisha. I don't know
Thank
how you
you.
find the energy, time, whatever you do. Please do what you're doing and keep doing it.
Thank you
I
so
feel like
much.
even with your illustrations, I've gone so many times to show my kids here and my colleagues here to say we can use
Yes.
something like this from Instagram. So illustrations only because I work with children. Otherwise, I
Okay,
will use all the
yeah.
other content, but you can clearly see my brain's
Yeah,
always thinks.
correct.
But yes, thank you so much for this.
Thank you,
And
everybody.
it's been lovely to see all of you. Hopefully, we meet in person next again.
I hope all of
Hopefully,
you
it was
can.
really nice meeting all of you. Yeah.
No,
All right.
yeah,
Thank you so much. Give me a
thank
minute.
you.
Thank you.
Hi, thank you so much for watching the video. If you have any queries, questions, doubts or discussions, add it down in the comments below and I'll help you out, or you can DM me on Instagram. Okay, bye.